know we are having a family picnic. Pharmacist. I they call you now. Pharmacist. Now they answer me. Oh. Pharmacist. Make una come out on Saturday. Oh. Make una come jollificate. Nobody say we go reach there now. We'll come be only 4 or 5 of us. You must all come out. We will take your personal pictures, and on that day we will paste them at the picnic venue. If we don't see you, we will find you. All right. Please, at this juncture, let me ask our wonderful APS representative to say hi to us. Thank you very much, and please, a beautiful round of applause for her.
Good morning, everyone. We are all welcome to this special program. I believe we are going to have a wonderful time. A round of applause for ourselves. Everyone here today is special. Thank you very much for coming. Thank you so much.
Thank you very much. We have our celebrant of the month. Papa is just walking in. Can we just give him a round of applause? And please, let's stand for him. Let's stand up and just celebrate our daddy. You're welcome, sir. You're welcome, sir. Amen. I can assure us that when I grow up to 80, I'll be as tall as Baba. We have in our midst very amiable and wonderful guests. Everybody's wonderful. Everybody's wonderful. Without you, of course, this event will not have taken place. And we'll start away with an opening prayer. With the opening prayer, and I want to ask pharmacist to please pinpoint somebody that is in the spirit. If you went to VG yesterday night, you probably have the spirit anointing on you. So please, let's start off.
Thank you very much. I would like to stand on existing protocol. I think we can do the opening prayer by saying the second standard of our national anthem. I believe every one of us is in the spirit. We all did our morning devotion, whichever way. So please, let's be on our feet as we take the second standard, O God of creation, as our opening prayer. Media, are we doing it with you or alone?
All rise, all compatriots, Nigeria's come amen.
Second standard, prayer now, O God of creation. 1, 2, go. O God of creation, direct our noble cause. Guide our world, lead us right. Help a youth the truth to know. In love and honesty to grow and live in just and true. Great lofty heights attain to build a nation where peace and justice shall reign. Amen.
Thank you very much. Please let me be well seated. Without this gentleman whose regime has brought giant strides to PSN Lagos State, we probably would not have been here. And on this note, I want to recognize the presence of the chairman of PSN Lagos State, pharmacist Bolagade Iyola, FPSN. And please majestically walk to the high table. I want to say that the table probably may not be higher than what the table in your front. just know that it's the table on our right side. If it's on your left side, it's the table on the left side. So we have also in our midst the registrar of the council. Am I right to say Pharmacy Council of Nigeria? Am I right? It's Pharmacy Council of Nigeria. Fantastic. Let's welcome our own pharmacist, Ahmed Babasheu, FPSN, the registrar of the council, to the high table. You're welcome, sir.
All right. We would like to welcome the keynote address speaker for today's event, who is no other than our own very own pharmacist Kunle Oyelano, the MD, CEO of GSK Pharmaceutical, FPSN. A round of applause for him as he comes forward. Let's keep clapping. Thank you very much, sir. We also like to welcome our chief host, the national president, Professor Cyril Osufo, FPSN, who is well represented by the national treasurer, national treasurer PSN, Pharmacist Gafar Madehi, FPSN. A round of applause for him too as he comes forward. Thank you very much. Please, let's keep clapping. Is he all right? He's coming. Thank you very much.
Thank you very much, Ma. Also, we have in our midst the director, R&R NAVDAC, Dr. Monica Emunjeze, FPSN. Madam, please, you are recognized and welcome to the high table. We'll be taking recognitions as we identify our guests, but we also just recognize the presence of pharmacist Lawrence Ekator, MAW, the chairman of ACP in Lagos State. Please just recognize you. We have the presence of Dr. Professor Ariola Joda, FPSN, representing NAPA. Chairman of NAPA, Lagos State, you're welcome. Please, all SEC PSN Lagos State representatives present. All SEC. All SEC PSN Lagos State Executive Committee Council committee members. Baba Yemi Oyekunle, Kola Sumonu, Captain Haruna Mbaya, okay. Arika Benson, I saw them. All right, okay. Let's keep that quickly.
All right, we'll be recognizing them as they come. Right now, we'll be taking the national anthem, immediately after which we'll start taking the presentation. So we'll be taking the national anthem now. Please, could we be upstanding as we take the national anthem?
All right, oh, compatriots, Nigeria's come of men to serve our fatherland with love and strength and faith. The land of our heroes was joining on in the land to serve with heart and mind.
like to recognize the presence of the Director of Pharmaceutical Services, Lagos State, Pharmacist Mrs. Olabisi Omolambe. A round of applause for her. Thank you very much. She's also our PIC Chairman, Lagos State. Hello, okay. Nature Field, please come forward. We would like to invite the engine room, the planner, the brain behind, the chief planning committee, the chairman of the planning committee of this program, Dr. Mrs. Onedo. A round of applause for her as she comes to the high table. Thank you very much, ma. Thank you very much. A round of applause. Let's keep clapping as she goes to her seat. Nature Field, are we ready?
While they are setting up their presentation details, we have in our midst also Pharmacist Shakirat Adeosun, MEW, DPS Primary Health Care Board. You are welcome, ma'am. While we're just talking, we had the presence. We have the presence of pharmacist Patrick Ikeja, the MD, Mayor Baker. Please, let's recognize him. You're welcome, sir. Nature Field, are you ready? Okay, setting up. PSN Lagos State, in the annals of PSN Nigeria, holds a lot of firsts. We have in our midst past chairman of PSN Lagos State, and please, I want us to roundly welcome and appreciate all past chairmen of Lagos State present here this moment, as we ask them to stand up for a worthy recognition. Daddy, you can sit down. Okay. Please, a round of applause, a round of applause, a round of applause. Let's appreciate them. Thank you, sirs. Thank you, sirs. We recognize your past contributions.
I also like to recognize the presence of one of our directors, all the way from Abuja, coming to honor this event of Lagos. Pharmacist Dr. Mrs. Omar Amina, the head of unit inspection and monitoring. You're welcome, ma. Thank you for coming all the way from Abuja. A round of applause for her. Thank you.
We know it's a day of, are we here? Let's welcome the chairman of the planning committee to tell us why she has brought us here. Please join me as we welcome pharmacist Dr. Titilayo Onedo, FPSN, as she gives her welcome remarks. Please, a round of applause for her. Abs, I thought you were clapping for her. Up, abs. Up, abs.
Thank you. the special guest of honor, pharmacist Patrick Ikeja, Merit Award winner, MD, CEO, May and Baker PLC. Our host, my chairman, pharmacist Bolagade Iyola, FPSN. The keynote speaker, pharmacist Olakunle Abdulaziz Oyelano, FPSN, the MD, CEO, GSK Pharmaceuticals PLC. The guest of honor, my registrar, pharmacist Ahmed Babashehu, FPSN. The special guest of honor, my sister, a friend, Dr. Monica A. Mujeze, FPSN, Director, Regulations and Registration, NAVDAC. Past chairman of Pharmaceutical Society of Nigeria, Lagos State Branch, fellows of Pharmaceutical Society of Nigeria, Merit Award winner, Lagos State PSN, colleagues, ladies and gentlemen, you are welcome. It gives me great pleasure to welcome you all to the year 2022 PSN Lagos State Scientific Week. The week commenced on Monday, the 26th of September, when the Association of Lady Pharmacists engaged the community at the Bariga LCDA. This was followed by the other technical groups on Tuesday, 27th, where all the other technical groups gathered at different locations in Lagos State to engage the community in our corporate social responsibility. On Wednesday, that was yesterday, we were all at the Secretariat, where we had master classes, very educative, very impactful. And for the people who were present, they will attest to the fact that we had a very nice time yesterday. It was, we had a lot to learn, a lot to drink. So many things went on that yesterday. And, okay, thank you. And I want to mention that the master classes were sponsored by GSK, Pfizer, and Emzo. So we are here today, Thursday, September 29th, to witness the grand opening ceremony of this year 2020 Scientific Week. The Council of Merit Award winners of PSN Lagos State Branch and PSN YPG are set to mark their own day with impactful activities scheduled for Friday, September 30th. This week, we ultimately climax with a family picnic on Saturday, October 1st. October 1st is a public holiday and is a family picnic. So I'm using this opportunity to invite every one of you to the picnic. It promises to be very interesting. I want to acknowledge the generous support of the chairman of the occasion, who is on her way. She has sent message to us. Oh, she just walked in now. You are welcome, ma. You are welcome, ma. So I want to acknowledge the generous support of the chairman of the occasion, Dr. Stella Okoli, FPSN, OON, the Group Managing Director, CEO of Enzo Group of Industries Limited, ably represented by pharmacist Uzoma Umezioke, the EDG of Enzo Pharmaceuticals Limited. I also want to appreciate Pharmacist Patrick Aja, MAW, the Managing Director of May and Baker Nigerian PLC, and of course the keynote address speaker, my brother, my friend, the MD CEO of Glaxo Welcome. I made this mistake last year, repeating itself again. Pharmacist Kunle Abdulaziz Oyelano, FPSN. We want to appreciate you, and we thank you for taking time to be here with us this morning. And this is because you actually counted us very, very important, and we appreciate your great commitment and your personal sacrifice to our society, our great society, Pharmaceutical Society of Nigeria, Lagos State. The theme of the week, innovative approach towards ensuring medicine security, the place of local production of API in Nigeria, is very apt and is timely. The reality of access to essential medicines in Nigeria, I want to assure you that pharmacist Kunle Oyelano, FPSN, is equal to the task of doing an in-depth exposition on the discourse. My gratitude to the Almighty God for his enablement to deliver on this program for the second time consecutively. For all of us who were gathered here last year, at this time last year, you remember that I was the chairman planning committee for the 2021 scientific conference. So I'm very grateful to God for sparing my life, for making me to be here again as the chairman 2022 annual scientific conference. So I am grateful to God for making this happen. And I also want to appreciate my chairman, Pharmacist Bolagade Iyola-led executive, for giving me this responsibility, for entrusting me with this great responsibility. And also, what we are doing today wouldn't have been possible without the great committee members that I have with me, because I couldn't have done it all by myself. I don't know if it's possible for me to ask that the committee members in the audience please stand up for. Thank you. I'm very, very grateful. They've all been very, very wonderful. I also want to thank the technical and the interest group for their activities. Like I said, we started on Monday, and we've had great sessions. The apps day was very, very beautiful, very impactful. Tuesday too, I had the opportunity to go to the Ikeja zone of ACPN, and they had a very great time too with the community, Ikeja community, engaging them, telling them about the danger of drug abuse. And I was also at the Association of Hospital and Administrative Pharmacists session, and they had very educative sessions too, whereby different hospitals came out to showcase what they have in the area of compounding. Compoundings were actually done in our secretariat that day, and people went away with the compounded products. And also lectures were given by experts in the hospital pharmacy session. So I thank you all. To all our dignitaries, the captains of industry, and representatives of the various arms of government and regulatory bodies, you are welcome also. I most sincerely appreciate all our sponsors as I enjoy you to relax. We strenuously prepared, as it is said to be unwrapped. Thank you all for being part of this great occasion. God bless you all.
Please, can we do more for her? We have in our midst representatives of the Board of Fellows at the highest echelon. And please permit me to recognize this revered group of pharmacists, ably represented by the Vice Chairman and the Secretary, Pharmacist Chief Morondia, Vice Chairman, Board of Fellows. You're welcome, ma. And Pharmacist Larry Familusi, who also doubles as a past chairman of PSN Lagos State, is the Secretary of Board of Fellows. You're welcome, sir. Now we have the media up. I had to be fasting and praying that the media should come up. Thank God he answers prayers. We have the one and only so far APS member who led PSN in a very wonderful Margaret Thatcher-like approach. I hope the entrance there is open, because I know her very well. By the time I drop this mic, I go here. Let's welcome our own pharmacist, BFO Adenira.
A round of applause for our mommy. Let's keep clapping. Let's keep clapping. Everybody here is very special. You're all welcome. We'd like to welcome and recognize in our midst the Dean of Faculty of Pharmacy, Professor Aderonke Adekwe-Pojubelu. A round of applause for her. She's also here with the past Dean, Pharmacist Bola Joko Aino, FPSN. A round of applause for her. Thank you very much for coming. We also like to recognize the presence of the National Chairman of NAIB, Pharmacist Kane Onigbu, FPSN, ably represented by the NAIB Director of Programs, Pharmacist Emeka Indinechi. A round of applause for him. I believe Nature Field is ready to deliver. All right, thank you very much. Please let's pay rapt attention. Nature Field, thank you.
Thank you. As she comes to pick up the mic, let's clap for her, Elizabeth Odewale. Am I right? Yeah, we had Mrs. Mrs. Pharmacist, Dr. Mrs. Am I right? Oyawole. She represents which group, ma? She's happy. And also we have also a former chairman of PSN. I don't want to connect the two of them together for now. Pharmacist ABO. You know who I'm talking about? ABO. Okay. Anthony Oyawole, FPSN. So you are looking as if you are not the one I'm talking about. So let's welcome Nature's Field. Thank you. Rapt attention. 10 minutes.
Thank you so much, sir. Good day, distinguished guests. My name is Elizabeth. I'm from Nature's Field Pharmaceutical Company, and I've come to introduce to us an effective an efficacious approach towards the management of your patients with AMD. But before I move forward, I would also like to recognize the special personnel on the high table. Good day, sirs and ma'ams. Thank you so much for the opportunity. Okay, of course, here, Nature's Field's vision basically is to be the foremost brand when it comes to the all ranges of health supplements and products. And that is why we always look forward to being the #1 brand to you, so that you can help recommend all our ranges of products to your patients. And of course, I said I'll be talking about an effective approach towards the management of AMD, which is age-related macular degeneration. So here I just have disease facts, basically from the National Eye Institute, stating about 85% of all visual impairments and 75% of blindness could actually be prevented or cured worldwide. This is just disease facts to let us have this mindset that blindness can be curbed and AMD can also be managed. And here, approximately 90% of the world's blind people are living in developing countries. Of course, Nigeria is one example of a developing country. So here I just have basically the eye disorders we have, the refractive errors, like I mentioned, age-related macular degeneration, which is a painless deterioration of the macula, which you are aware, MAS and SAS. And of course, glaucoma, cataract, diabetic retinopathy, and computer vision syndrome, which of course we youngsters of this generation are guilty of, because we tend to stare long on our phone screens. Okay, like I mentioned, I'll be dwelling more on age-related macular degeneration, which I mentioned is a gradual and painless deterioration of the macula. And it affects, of course, you're aware, it affects patients above the age of 50. And why am I talking about AMD? Because the Nature's Field brand that I'm going to be talking about is majorly with respect to management of AMD. Now, so far so good, there has not been a cure to AMD, but we can manage it and also delay the disease progression, which is our major objective. Delay the disease progression, improve patients' quality of life, and of course, prevent blindness. And it's the third largest world cause of visual impairments in Western country, and is often the leading cause of blindness. Okay, next slide. Okay, here is just a pictorial representation of a healthy eye and an eye with age-related macular degeneration, and as we can see, we have the drusen scattered all around the macular region, damaging the macula, which is of course located at the posterior part, the retina of the eye. Okay, so here the previous slide is just showing a view of a patient with AMD. This is the normal vision. This is what a patient would see, but a patient with AMD it affects majorly the central vision, then over time extends to the peripheral vision. And so, the next slide, please. The impact and implication of AMD. This, in a way or two, affects the quality of life and causes anxiety disorders, increased morbidity, mortality, and this is actually what we are looking at curbing. The risk factors are stated there, which is aging, of course, from the name, age-related. Smoking too is also a huge risk factor, genetic disorder, diet, sedentary lifestyle, and the likes. Okay, yes, here is just general symptoms, what each patient sees. It starts from fuzzy or blurry vision. Some patients even still complain that once they leave an enclosed room, by the time they get out there, it becomes foggy, fuzzy. So that is usually much of the symptoms we get from them. And straight lines appears to be wavy and the likes. Okay. Next slide. Oh, here. So here is talking about how we are proposing to manage AMD. Like I mentioned, up until now, there has not been a known treatment goal to AMD since it's age-related. But the objective is to delay the disease progression and also buy more time for the patients. So here we are saying to manage AMD, each patient needs to modify the lifestyle, avoid UV lights or blue lights, and also the introduction of nutritional supplements that are rich in antioxidants, which is where my products come in, and which is, of course, why Nature's Field deem it fit to be the foremost brand when it comes to management of AMD. And this is just very quickly talking about computer vision syndrome. My product is also positioned to manage this. Like I mentioned, Saz and Maz, that we youngsters are guilty of staring long on our phone screens, our tablets, even, what do you call it? Generally screen time. So this actually affects the eye, thereby causing digital eye strain. So my product, which is rich in antioxidants, it's a unique blend, is also positioned to manage computer vision syndrome. And the next slide is just talking about ARED study. Now, why I imputed ARED study design is to let us understand that we are compliant with the age-related eye disease study, which the objective is to look at the efficacy and the safety of lutein and zeaxanthin in the management of AMD and cataract. I believe we know the ARED study, but I just had to impute it. So from ARED study, what was discovered was that lutein and zeaxanthin actually gave more it actually mopped up more free radicals when it comes to management of AMD. And this is what I have in my eye cap. So I want to introduce to you Nature's Field Eye Cap. Nature's Field Eye Cap is a unique blend, like I've mentioned. It is RS2 compliant. Why do I say it's RS2 compliant? Because I mentioned it contains lutein and zeaxanthin. And a master eye antioxidant, which is glutathione. And glutathione is a unique constituent when it comes to preventing formation of cataracts and also scavenging free radicals. And I have one more unique constituent in Nature's Field Eye Cap, which is bilberry extract. One interesting thing about bilberry extract is it helps reduce intraocular pressure. And this is one unique constituent I always love to talk about. Yes, it's gotten from the bilberry tree. And it also has some amount of, studies have shown that it has some amount of zeaxanthin in it, which also still help scavenge for free radicals. And I also have Eye Bright Herb Powder in my Nature's Field Eye Cap. Eye Bright Herb Powder, it's unique when it comes to allergic conjunctivitis. So you'd see that Nature's Field is not only just an eye antioxidant, but a unique blend of antioxidants. Aside the routine vitamin A's, vitamin C's, we have unique blends of it. And the indication area, like I mentioned, is to manage patients with AMD, and a unique adjuvant treatment when it comes to management of glaucoma and cataract due to the unique constituents I just mentioned. And all of this is just in one tablet daily. So I would appreciate if you also visit our stand and choose the eye antioxidants that work, which is Nature's Field Eye Cap. Thank you so much for the opportunity and the time.
Thank you. A round of applause for Nature Field. I have a question for you. Are the capsules for only people that have eye issues, or if to prevent it, can I use your multivitamins?
Thank you, ma'am. So yes, you can use Nature's Field Eye Cap for adults desiring extra nutritional supplements. You can use 1 tablet of Nature's Field.
Okay, so thank you very much. A round of applause for Nature Field.
Thank you very much. Nature's Field, before you go, those of us wearing glasses, we will take enough samples that will last us the next annual scientific week. So we'll come and testify. But I can tell you that the product works. Very fantastic product. Thank you for supporting us. Thank you very much. Quick one. I want to believe that LB Pharma is getting set. Good. But before you take the mic, we want to recognize also my very good daddy, fantastic gentleman, man of God, pharmacist Victor Fakulujo, FPSN, also former chairman of PSN. You can recognize that this table is table of former chairmen, and they are all in white. Was it planned? You planned it. You are in the spirit, oh. How can I join that group? I think that actually we are associate membership. We also have our daddy we have recognized before. Well, let's just clap for daddy, pharmacist Ebenezer Adeleke, former chairman. Daddy, just a wave of hand. And pharmacist Oshureko, Laide, FPSN. Daddy, God bless you, sir. Thanks for coming. We appreciate you all. I know the chairman of the CPC was, she was presenting her welcome address. She recognized the entry of the representative of the chairman of the occasion, Dr. Mrs. Stella Okoli, MON, FPSN, who is ably represented today by pharmacist Uzoma Ezeoke, executive, I think she's his daughter. Yeah. Executive Director General. Can we clap for her? EMSO Group of Industries. You're welcome, man. So we take the next presentation by LB Pharma. LB, are you ready? Please come forward.
Please, sir. Well, good day, sir. The chairman of the occasion, the director of pharmaceutical services. Please permit me to stand on existing protocols, please. My name is Shabi Abdurazak Adesola, and it's indeed a great pleasure being in your presence today to make this presentation. I represent Heavy Pharma Limited, and Heavy is a wholly indigenous pharmaceutical company. And today is with a great humbleness or humility we are making this presentation in hope that we'll have one or two things that will be of benefit to our patients that we interact with every day. Well, today our topic is, I'm not here alone, I'm together with my other colleague, Fikayo Oluborode. Today we are looking at effective and complete treatment of severe malaria. We know every day we manage malaria, but when it comes to severe malaria, it becomes another issue of concern. And we are looking at how we can be innovative and be more helpful in the management. And we say what? Effective and complete treatment of what? Severe malaria. With severe malaria, a severe malaria patient is classified as that patient that has an acute malaria attack that is unable to tolerate any oral modification or could not stand or walk or sit by itself. These are classical symptoms that we should be able to identify, particularly in children. And because in many community pharmacy and other places of practices, you see a patient, you will find it difficult to classify. But once a patient is unable to tolerate oral medication or could not sit, stand, or walk by itself, it is classified as severe malaria, and it is what? It is a medical emergency, which we can be of intervention to. And in this situation, the parasitemia is always greater than 5%. The symptoms are, one, parasitemia is actually greater than 10,000 microliter per 10,000 units per microliter. Then there is prostration, there is stretching and all those signs. Then there is impaired consciousness, multiple convulsions, hypoglycemia, severe anemia, and many like that. And once it is not well managed on time, there is progression to complication, and it is this complication we are trying to avoid, as it and ranges from neurological damage to neurocognitive sequel, hypoglycemia, and as well as multiple convulsion and death. And this means that there must be compliance with with WHO recommendation in terms of treatment management guideline. And what does WHO say? WHO recommend a full dose of parenteral anti-malaria treatment with effective and available drug immediately without delay. That is, a parenteral administration of anti-malaria becomes very important. This is not where oral medication works in, and should be given within 24 hours, available parenteral medications. However, with advancement, it used to be quinine in the past, but with advancement in the management, yes, WHO recognizes and prefer parenteral artemisinin derivative as a mainstay, as a suitable substitute to quinine in the management of this patient, which means if a pharmacist or any medical doctor or a nurse decide to administer a parenteral diarrhetamicinin or artemisinin derivatives, you are on course, provided you can manage the patient well. Artemisinin derivative can, however, be classified into three. We have the artesunate, which is the oldest with highest profiles of literatures, but it is water soluble. However, it is first generation parenteral artemisinin derivatives, and it has its limitations of being unstable. So immediately you constitute to use. However, in the pharmacokinetic profile too, you could have one or two drawbacks, which the researchers will teach me better in this area, and that limits its performance. We also have the artemether injection, which is the second generation of artemisinin derivatives with a short half-life and a long number of days treatment regimen, which happens to be its own limitation, and at the same time your fear of methanol toxicity in the pediatric. And this brings us to the third generation of the artemisinin derivative, which is alpha beta arteita. It is a third generation artemisinin derivative. It has a fast onset of action and has a long half-life, and this gives us the convenience and suitability of once daily dose administration and a short number of days for treatment regimen, which is just 3 days. Taking an analysis of the pharmacokinetics parameters, we have been made to understand, or we come to understand, that in terms of comparison, the alpha beta arteita is a diasteroma of the alpha and the beta moiety. It tends to confer some pharmacokinetic benefit in terms of if you take a look at the parasite clearance times, it has 24 to 48 hours parasite clearance, and a faster clearance times than artemether and artesunate. Then the mean cure rate is 97%, which is even higher than artemether, but at par with artesunate. Then you have elimination half-life to be 20 hours, but to cut it short, it has a 3 days dosage regimen. You have actually been using this brand, one form of this brand or the other. But today we introduce to you a more affordable brand of alpha beta arteita, which is simply alpha beta, the way you call it, alpha beta. No thinking, no long thing. So alpha beta is available for intramuscular injection only, and it is a 3 ampoule of 150 milligram by 2 ml for the adult dose, and 75 milligram per 1 ml for the children dosage, and it is once daily administration for 3 days. Then it has all the I have told it is the asteroma of the mixture of the alpha beta arteita and with the benefit. However, it is very fast. It has a fast onset of action, low parasite clearance time, and a array of other benefit. But with administration of alpha beta arteita in management of severe malaria, our treatment is not complete. You must do a follow-up. It's either you administer the parenteral for 1 day, or you complete it for the number of 3 days or 5 days, depending on the type you are doing. But there must be a follow-up. There must be a follow-up therapy, and this is where, because the patient that has a resistant malaria would have been exposed to one form of first line of artemisinin ACT combination or the other, you tweak your drug in this situation. You go we recommend you do a follow-up with a second line brand, and this is where diarrhetamicinin piperaquine formulation comes in. And what am I saying here today is that ibastinate should be your choice of a follow-up therapy for such patients. One, it offers It offers convenience, it offers simplicities, and it offers it confuses the malaria parasite that becomes resistant in these situations, and which is very, very important because they have different mechanisms of developing resistance. So we are saying that it's a brand of diarrhetamicinin, and it is a WHO-approved formulation for treatment of malaria. However, it is just a 3 days. They are telling me my time is up. In 2 minutes, I'll be done now. It is a 3-day dosage regimen, and the dosage are calibrated based on the age and the children. And this formulation tends to be better and well tolerated than what amodiaquine and artesunate formulation, and it could be of a unique, benefit in patients that has been exposed to suboptimal or substandard forms of first-line formulation of any form of artemether, lumefantrine, and the like. Thank you for the time. I'm sorry for your time. I've taken too much. Yeah.
Malaria is in trouble. With this kind of presentation, clearance rate is how many seconds? It's less than 30 seconds. I can assure us that these products are fantastic. Let's give him a round of applause. Fantastic presentation. We look alike. I thought he's my brother. Come, sir. Hello, sir. Come. You're my brother. I'm taller than you. It's not I mean. Thank you very much.
Thank you very much, LB. So to confuse malaria, we use ibasunate. Am I right? All right. A round of applause for them. Thank you for your support. All right. We would like to recognize the presence of the Commissioner of Police, Lagos State Command. We appreciate very much your support to the pharmacists in Lagos. He's well represented by ACP Olukemi M. Tijani. A round of applause. Okay. Thank you very much for coming, Ma. Thank you. All right. We'll be calling on the next company.
My chairman, sir. We'll call you.
Calm down.
Calm down. You brought us here. So, Jayoff, pharmacist Unduka Ogbonaya, he's been itching to talk to us. And we are having reducing balance. 10 minutes, 7.5 minutes, now 5 minutes. 5 minutes. Pharmacists don't talk more than 5 minutes in presentations. Thank you very much for keeping it to 5 minutes.
Thank you. Good day, distinguished pharmacists and guests. It's my pleasure to present topic cream from Job Pharmaceuticals today. Okay, so today I just want to quickly present topic cream, which is the brand of sorry, this is not moving. Yeah, the arrow is not moving. Okay, but let me just quickly keep talking. So Topic Cream is actually a French brand of range of dermatological products for skincare. It caters to all forms of almost every form of skin problem. And in Nigeria, Joff has got the franchise and has got it being distributed across the country. A Topic Cream is actually a leading brand preferred by dermatologists, pharmacists, and all healthcare professionals that handle skin problems. Because of the time I'm given, I will just tell you what is the range. I think, can you just help me scroll it? Go ahead. Go ahead. Okay, stop here. Okay, let me just talk about the range so that we know what is available from Jove. So Topic Cream has got the Topic Cream Ultra Moisturizing Body. These ones take care of everything concerning sensitive skins and dry skins and the problems associated with it. Then there is the Topic Cream DA. The DA is a range of products that cater to atopic skins, because atopic skins is is why the incidence of atopic skin is so much in Nigeria. We have all these eczema, itching, rashes, very sensitive skin. So the topic cream ADA range covers a lot of things that we can use, from the emollient balms to the emollient oils to the body washes and so on. Then we have the topic cream Mela range for hyperpigmentation. So it has the hyperpigmentation. We have products for hyperpigmentation of the body, where there are black spots or dark spots that spoil the complexion. We have things that can correct that. We have that for the hyperpigmentation of the face as well. So where there are dark spots or black spots on the face, we have products that will take care of that. Then we have the topic cream products for acne-prone skins. So that's the AC range. So for people that have very oily skin or skin that is prone to acne, that have pimples, blackheads, and so on, topic cream has got a range of products starting from cleansing gels, cleansing oil, active care ranges for mattifying care and compensating care and so on. Then we have the URO10 range, which caters to people with very severe xerosis or dry skin. So, and other conditions associated with that, like psoriasis, like ichthyosis, and so on. So the URO10 range covers that. It's a whole range of products. Then we have the Sika range. The Sika range caters to damaged skins. So for irritated and damaged skins, we have products from Sika that take care of that. And then we have another Sika range that caters to stretch marks and scars that are old. So we have products that can relieve stretch marks, cure new stretch marks, prevent stretch marks, like in cases of pregnancy, and where some skin is prone to stretching. Then we have the sun protection range, where we have the SPF 50 plus CAM. So this caters to sun-sensitive skin. So it's very good for people that have sun-sensitive skin, like albinos and every other person that is exposed to the sun. So I would say topic cream equally has an exhibition stand there. So we will look forward to seeing you there and explain further and show you what we have got for you today. Thank you very much.
A round of applause for Jove Pharmaceuticals. So topic cream is the answer. Either you want to be a black beauty or a yellow beauty, spotless skin. Topic cream. A round of applause for them. We are coming to the crux of the event. We would like to invite our own, very own chairman, PSN Lagos State Branch, as he comes forward for the opening address. Let's put our hands together for Pharmacist Bola Gade Yola, FPSN. A round of applause. Please let's keep clapping as he comes forward. Thank you, our chairman. Let's keep clapping. Are we tired? Thank you very much, sir.
Good morning, everybody. The president of the Pharmaceutical Society of Nigeria, Professor Pharmacist Cyril Usifo, fellow of the Pharmaceutical Society of Nigeria, ably represented here today by the National Treasurer of PSN, Pharmacist Gafar Amadein, fellow of the society. The chairman of today's occasion, our own very dear Dr. Mrs. Stella Okoli, MON, OON, FPSN, the Managing Director, Chief Executive Officer of EMSO Group of Industries. Also ably represented here today by our own very dear pharmacist, Mrs. Uzoma is okay. The executive director, general duties, EMSO Group of Industries. You are very welcome, ma. It's my pleasure also to acknowledge the presence of our brand new registrar. And I'm very sure this is the first time he's coming into our gathering in Lagos State. My own very dear friend and brother, pharmacist Ahmed Babasheo, fellow of the Pharmaceutical Society of Nigeria, fellow of the West African Postgraduate College of Pharmacists, the registrar, Pharmacy Council of Nigeria. You're welcome, sir. I also want to acknowledge the presence of the special guest of honor of today, my own brother, pharmacist Patrick Ikeja, Merit Award winner of this state branch, the MD CEO of May and Baker PLC. You are welcome, sir. It's my pleasure and honor to acknowledge the presence of the keynote speaker for today, who happened to be the chairman of the occasion last year during the 2021 Annual Pharmacy Week. Pharmacist Kunle Oyelana, fellow of the society, MD CEO of GlaxoSmithKline Pharmaceutical PLC. You are very welcome, sir. Please, you need to give him another round of applause because to a greater extent, we are not dipping into the treasure of PSN to host this occasion. Courtesy GSK, courtesy Pfizer, courtesy EMSO Group of Industries. So I think our applause should be very resounding. Thank you very much. Thank you. I also have here my own very sister, because she knows that we will have called family meeting on her head if she had not come. Dr. Monica Emunjese, Director of Registration and Regulation, NAFDAC. Thank you for coming, ma. Well, standing here today, I have a crop of leaders I've looked up to be like them when I grew up then. I think I've grown up to an extent now. They are here. The pillars of PSN Lagos, the past chairman. It's my pleasure and honor to ask him to stand for recognition. Our chairman, 1983 to 1985, Pharmacist Lady Oshundeko, fellow of the society. You are welcome, sir. Please, you can have your seat. The little secret, I was a small boy when he was chairman, so I didn't even look up to him because I was still in secondary school. I have our birthday boy here too, Pharmacist Ebenezer Adeleke. Was our past chairman in 1988, 1991. Today we have Pharmacist Victor Fakulujo, our spiritual father. He was our chairman 1999 to 2002. You are welcome, sir. I have here also Pharmacist Tony Oyawole. He presided over the state branch between 2005 and 2008. And I have the Baba of our boys, the father of the boys, Pharmacist Lanre Familusi, was chairman 2008 to 2011. And I have Pharmacist Benga Olubowale, the GO, chairman 2011 to 2014. I also have here our mama in the house, pharmacist Mrs. Bolanle Adeniran, my immediate past chairman, 2014 to 2017. You'll be wondering why I'm calling their name like this, because today we will celebrate them, because we want to take a marked departure from the tradition of the past when chairmen will serve and they will just go back unnoticed. Because as they are sitting down, I'm sure none of them can, except for the immediate past chairman that we gave appreciation award to. So today we are going to celebrate them in a way that you'll be very proud of PSN. A round of applause for them once again. I recognize our brother, the Commissioner of Police, Lagos State, ably represented by the ACP. You are welcome once again, man. We're very happy to have you in our midst. I've been working with 3 DPSs in Lagos. Our DPS in the Ministry of Health, Pharmacist Olabisi Omalambe. I saw her. Maybe she has stepped out. Oh, she's here. You are welcome, ma. We have been working very well at the PIC level. Then I also have the pleasure of recognizing the presence of Pharmacist Shegun Onakoya, my brother, the DPS Health Service Commission. We also have the pleasure of the presence of Pharmacist Shakira Tadeoshun, the DPS Primary Health Care Board. Thank you for coming. And I want to recognize, I think I saw him. I would like to recognize all the HODs of the federal health institutions in Lagos. I saw the HOD of Neuropsychiatric Hospital, the pharmacy department, Pharmacy Yetunde Ajayi. We are very happy to have you in our presence today. And we also have the former HOD. I think I saw Pharmacist Oluranti Okwanuga, former HOD Lutz. Yes. Oh, she was with us yesterday during the masterclass session. We also have in our presence and our midst today, Pharmacist Gloria Ukwoma, the former HOD of Federal Medical Center, Butemeta. You're welcome. Thank you. Thank you. We are yet to do the send forth. Definitely, we will go like this to come to the send forth. I want to acknowledge the presence of all the chairmen of technical groups that are present here. Pharmacist Ken Unwegbu is ably represented. And I can see Pharmacist Lawrence Ekato, Pharmacist Modupe Oyawole, and Dr. Arinola Joda. Thank you for coming. All the fellows present, we acknowledge your presence, and Merit Award winner of the state branch, thank you for coming. It is a great honor and pleasure for me to welcome you all to that season of the year when we specially celebrate pharmacy practice in Lagos State. The spirit of the theme of the week has been widely spread since Monday, when we took off with the technical and interest group activities up to the master class sessions, which aired yesterday. The 2022 Scientific Week affords us the privilege to share perspectives on development in the pharma space. I want to itemize this issue like this. Number 1, circular on consultant status for pharmacists in Lagos State Public Service. Chairman of the occasion, distinguished guests, you will recall that the journey to attaining consultant cadre for pharmacists has been taught to us in Nigeria since 2011, when the National Council on Establishment gave its approval before the eventual implementation circular that was released by the Office of Head of Service of the Federation in 2020. For us in Lagos, in a bid to get the suspended approval of the consultant cadre for pharmacists by Ambode administration reinstated, the PSN Lagos State branch, in alignment with Nigerian Union of Allied Health Professionals Lagos State branch, had liaised with JOESO at national level to get the Lagos State government to do the needful. This culminated in the PSN and Association of Medical Laboratory Scientists of Nigeria, in conjunction with NOHAP and Lagos State governments, to sit on the negotiation table in February this year. This development was amplified with a letter from JOESO leadership. The JOESO has again sent a reminder to the Lagos government, while the PSN Lagos State branch has also recently inundated Governor Sanwo-Olu of some pharmaceutical matters in the last few days. For us in PSN, we shall give the governor of Lagos State a timeline not exceeding few weeks to redress this matter, after which we shall seek full intervention of relevant unions and professional groups. I do hope credible leaders in Lagos State will advise Governor Sanwo-Olu before the sun sets. Number 2, establishment of Faculty of Pharmacy in Lagos University. The PSN Lagos State branch finds it necessary to commend the Lagos State government for the establishment of Faculty of Pharmacy at the Lagos State University. Considering the resources available to Lagos State government, we hope that the school will soon become a benchmark in pharmacy education. We also wish to strongly clamor that its focus must be in Doctor of Pharmacy degree program, which will become the minimal registrable degree by the Pharmacy Council of Nigeria in a few years. It is also important to impress it on the government to appoint credible and very experienced scholars in pharmacy practice to give quality leadership in the new schools. This ordinarily should not pose a challenge in Lagos and the Southwest geopolitical zone, where we have an array of seasoned academic pharmacists who are world-class teachers and consultants to WHO, UNIDO, and other global bodies. Our clarion call to the Lagos State government will be incomplete if you do not also inform that the Faculty of Pharmacy at Lagos State University must enjoy a full autonomy status. A quick check around the nation will confirm that all our recognized schools, over 20 of them, are autonomous and not aligned or subsumed in marriages of inconvenience with any other structure. Once again, we congratulate Governor Sanwo-Olu and encourage him to normalize the complications around the new pharmacy school so that it has a sound takeoff. Number 3, Pharmacy Council of Nigeria, Act 2022. The PSN Lagos State branch joins patriots in pharmacy circle to salute President Buhari and National Assembly for actualizing the Pharmacy Council of Nigeria bill after 8 years it was started. We owe a debt of gratitude to the PSN College of Past Presidents, the immediate past registrar, Dr. N.A.E. Mohammed, and the incumbent that is sitting among us today, Pharmacist Ibrahim Babashehu Ahmed, FPSN, who bowed the registry of PCN to ensure that the PCNB became an act of parliament. We need to specially commend the president of PSN, Professor Cyril Lucifo, for ensuring that the bill returned to the presidency the third time. Immediately he emerged as president in November 2021. The president mobilized needed resources for advocacy with the backing of the technical and interest groups. The end result is the Browning Act passed by the National Assembly and duly assented to by President Muhammadu Buhari, GCFR. The Pharmacy Council of Nigeria Act 2022 is the needed tool to enhance monitoring and control of pharmaceutical premises, to expand services through satellite pharmacies, entrench pharmacy-based resource in healthcare, to revolutionize industrial pharmacy and restore dignity to community pharmacy practice. These expectations will not come true if we continue. These expectations will come true if we continue to support our leadership at all levels. Number 4, Forum of Past Chairmen of PSN Lagos State Branch. The chairman and distinguished guest. Leading PSN Lagos State Branch has been tasking, but very fulfilling, with avalanche of wise men on whose shoulders we have leaned for support and direction. Over the years, PSN Lagos State Branch has continued to flourish and fulfill its mandate of being the major advocates of pharmacy profession. This is majorly due to the fact that our branch had been led by a crop of the finest breed of leaders who had bequeathed excellent leadership tenets with selflessness and great sacrifice. The trajectory of our growth towards our iconic stature can only be attributed to the adroit management and civility of leadership deployed over time by these great men. Our executive counts it a great honor and privilege to recognize these great heroes by officially inaugurating a forum of past chairmen of PSN Lagos as one of the most important organs of PSN Lagos State Branch. This forum will majorly be saddled with onerous responsibility of serving as the moral and conscience compass of the society, in addition with also being our think tank. The executive committee member has also decided that one of the past chairmen who is unavailably absent today, who happens to be the link between the old and the young, pharmacist Honorable Jimmy Agbaje, will be the chairman of the forum of the past chairmen. So at this junction, I would like to invite the registrar and the chairman of the occasion to step forward, because we are going to decorate our past chairman today before we go ahead with the program of today. Can you please step forward? I need the director of programs, wherever they are, to assist us. Please, I would like to call on, because calling them, we have to be in order of seniority. So I want to call on our daddy, Pharmacist Lady Oshondeko, fellow of the society, to step forward, sir. She will be. Okay. Well done, sir. Then the line of them.
Oh, am I holding this for you?
I thought you will.
No, I think you were doing that.
No, I've done
doing
it
the
already.
introduction.
I will just be calling the name you present. You can see
So I
any.
don't need the,
Don't
I
want
don't
to.
need the mic.
No, that.
On behalf of PSN, Lagos State, you're to be doubly decorated. You know, sometimes you only get a plaque, sometimes you only get thank you, sometimes you only get an invitation to other events. So it's our delight to recognize you for your past service. So I'm going to hand this over so that.
Yeah, just wait. I want to quickly call on pharmacist Jimmy Agbaje, ably represented here by pharmacist Larry Familusi, to step forward to collect the plaque and the medal. Sorry, that's a slight on my part. I want to call on pharmacist Ebenezer Adeleke.
You know what? I think we're going to sing happy birthday. Somebody just celebrated an 80th birthday along with his wonderful wife at 75, and that was last Saturday. So we've known Farmer Deleke for so many years. How many people have ever received a devotional sent by him? Yes. So he's consistent, and it shows in everything that you do, sir. So we ask God to preserve your years, that the sweetest of wine is what you begin to enjoy in this season, that your health he would increase and your joy, and that the works of your hands will be established so that this entire room can stand upon them. We just celebrate you, sir. Thank you. Oh, we're going to sing happy birthday. No. Okay, you know what? We'll just, to manage the time, I'll count down from 3 to 1, and I want you to give a loud happy birthday. 3, 2, 1. Happy birthday! Thank you, sir. Do you want the mic?
As men of honor, I thank God that I did not go to dentistry. I'm not degrading dentistry by anything, but that was my first love. Circumstances now made me to study pharmacy. I've never regretted it. You have honored me, God will honor you all. We honor our profession. Thank you.
No, here.
very good. Yes, thank you.
I'm calling on pharmacist Lanre Familusi to step forward to receive the medal and the plaque for Honorable Jimmy Agbaje. A round of applause for him as he's stepping forward. Pharmacist Victor Fakolujo, ẹ̀yin ló kàn. Yes. I want to call on Pharmacist Tony Oyawole to step forward to receive the plaque and medallion on behalf of the past president of PSN, Pharmacist Olumide Akintayo. Please give him a round of applause as he's stepping forward. And beautifully enough, he will be stepping forward to receive his own immediately. Then I call on pharmacist Anthony Bola Oyawole. I want to call on pharmacist Lanre Familusi to step forward to collect his own. Akintunde Ugwembe, who is in faraway United States of America. And it's your turn to receive your own too. Quickly come back. Pharmacist Benga Olubowale. Yes. Yes. Yes, I think it's time for us to call our own Margaret Thatcher. So that at least we are two now that she will spank. Pharmacist Mrs. Bolanle Adeniran. Yes, I think we need a response from the... Yes. Before we do that, I think as I'm calling the representative of the... I want to call on pharmacist Olaide Oshondeko to speak on behalf of the forum. And as he's doing that, I will still enjoin our past chairman to step up so that they can take group photographs together. You can come forward, sirs.
The chairman of the occasion, chairman of the pharmacists, registrar of the Pharmacists Council of Nigeria, Pharmacy Council, pardon me, chairman Lagos State PSN, all other protocols observed. It gives me great pleasure to be among these august visitors or colleagues. I'm particularly happy because some of the good things some of us did are still being kept. I'm also happy that among the past chairmen, at least I can say two work with me closely. Mrs. Bola Adeniran, Lanre Familuse. We work together in various positions, either co-farm or PSN. And some of the things I think gives me joy is that what we initiated as something we felt we should give deserving pharmacists in Lagos who continue to contribute to the dynamism and progress of PSN National. That is the Merit Award. I am happy because I brought this idea up when I was chairman of Lagos State PSN. And I'll tell you what led to it. At the Fellowship Award of 1983, I felt that we were not given due representation in the number chosen. And I doubt very much if any state branch contributes as much as Lagos State branch contributes to national body of PSN. At that time, well, I won't say quota, but I felt that many of us, including late Bill Oyetunji, many of us were skipped. Even though the names were presented, but many of us were skipped. So when we came back, I muted the idea that yes, in order not to discourage active participation, we must give something to recognize and appreciate our members for contributing their quota to the progress of the profession and the society. That was what brought up the idea of Merit Award. And I'm happy that some states have emulated us. But sadly, I want to say that I'm not happy that Lagos State Co-Farm has gone under. Lagos Co-Farm was established, it was the second registered cooperative pharmacy in Nigeria, Kwara State being the first. Lagos State Co-Farm was the second to be registered, and it was registered as a multi-purpose cooperative society. In which case, even if the pharmacy arm is dead, the thrift and savings and loans arm could still be kept. So I am raising this that maybe you can look into it. If you go look into the records, you will see the certificate of registration. Please let Lagos State Co-Farm be resuscitated. On behalf of all of us, I want to thank this present executive committee for this novel idea of instituting chairman. Something similar to this was done about 15 years ago, but it was just mere award. You have gone a step further by constituting the body. And I thank God for putting it in the mind of this executive to make our own Jimmy Agbaje the chairman of the body. Like I told the chairman, you do not know that even politically, they may be on different sides, but I have attended at least 2 or 3 occasions where I saw the warm embrace between the present Lagos State governor and our own Jimmy Agbaje. So it's a good choice that if this body can take up the issue of consultancy of pharmacy with the governor, I doubt if the governor would not want to see a team having a Jimmy Agbaje as the leader. I doubt very much. So I'm giving this as a suggestion. Another person I personally would have used, but I'm hesitating, is the chairman of the Public Service Commission, who is a close relation of the governor. But why I'm hesitating is that the husband is the Director General, Chief Medical Director of LASUT. So, you know the politics between pharmacy and medicine. But all the same, I will still try on my own. So I want to thank you very much, sincerely. The wisdom God gave this present executive, God will continue to increase it. And Lagos PSN will continue to lead. Never mind that when it comes to election, we are not able to pull enough weight. But let's not be discouraged. The important thing is that within our own state, let us make correct vibe, correct move to get pharmacy to where it belongs. I can tell you that I'm happy Mr. Adeleke is here. It wasn't easy for us to get the Directorate of Pharmaceutical Services established. At a time when we met the Commissioner of Health, I was chairman of Lagos State. It was a direct confrontation between me and that. Yes, it was being partial because it's pharmacy, that if it's medicine, he would not hesitate to fill that position of Director of Pharmaceutical Services. And within 6 months, of course, my own classmate and friend, Dr. Femi Shuemo, was appointed the first Director of Pharmaceutical Services, Lagos State. So let us not be tired of fighting. We have got Pharmacy Act instead of Pharmacist Act. There are some advantages there. Pharmacy technicians and all these other people can now be properly brought under Pharmacy Act. Unlike Pharmacists Act, which from the name means pharmacists only. That to me is what is novel there. And may God bless all those that worked for this achievement. Thank you very much for this. Thank you.
Thank you very much. In conclusion of this address, I must continue to convey my gratitude to our members who have been supportive all the way. One of the gains of our collective and collaborative support remains the resilience and progressivity with which we wrestle for the chairmanship of Healthcare Providers Association of Nigeria in Lagos State. We drew strength from the president of PSN, College of Past Presidents, Forum of Past Chairmen, members of Board of Fellows, and Merit Award winners, as well as the entire membership of PSN Lagos State branch. I want to also announce to us that last week, one of us was elected as the Secretary General of the Association of Professional Bodies of Nigeria, pharmacist Mrs. Folake Adeniyi. I don't know whether she's here. Yes, congratulations, ma. Let us savor the new experience in this scientific week. I expect to see you in good numbers in Jos for the PSN Annual National Conference. I thank you all for your attention and declare that God will bless you all. But before I step down, let me acknowledge the presence of our own very dear sister, Mrs. Adetutu Afolabi. It's one of our special guests. I think I saw her. And I also want to acknowledge the presence of my very own sister, Mrs. Folusho Babashola, consultant to Unilever. Can you please stand up for recognition? PSN Lagos State was able to bless a good number of our members with cartons of Pepsodent. It's courtesy Mrs. Babashola. Thank you very much. God bless you all.
That round of applause actually wasn't meant for that chairman. Not our chairman. I think he deserves a standing ovation. He deserves a standing ovation. Yes. Anybody that has... chairman, sir, I'm just short of words. Thank you very much. Thank you very much. Thanks for the honor. When they select you can't serve, you they dodge. There will be a time for recognition. So whatever you sow now, you reap in the future. Thank you very much, sir.
We'll be continuing our program by listening to another presentation from Oswald Pharmaceutical. I believe they are ready. Pharmacist Ehile. You're ready? Please step forward. While Elumi Data also get ready, they will present immediately after Oswald. A round of applause for him as he comes forward.
Good afternoon, highly distinguished pharmacists, distinguished guests of the high table. Permit me to remain standing on existing protocol. My name is Ehilen, and I work with Oswald Nigeria Limited. Oswald Nigeria Limited is a subsidiary of May and Baker, and we are in the business of providing quality pharmaceutical products to the populations of Nigeria and also the sub-Saharan African countries. We have very outstanding products in the market. One of it, Tidy Nail Cream, Tidy Seal Cream, Oswald Sipo, and other good brands. But today I'll be talking on Borocare Neem Cream. Borocare Neem Cream is a special formulation because it contains natural ingredients. And it's a must-have in every home. And in the course of the presentation, you will know why I said that. So the natural ingredients in Borocare Neem Cream is neem plants. That's the popular dongoyaro. And it has been shown to have antimicrobial activities and also wound healing activities. Also, another vital ingredient in Borocare Neem Cream is aloe vera. Aloe vera has been shown over the years to be very effective in treatment of first and second degree burns. It also has anti-inflammatory properties. Another ingredient in Borocare Neem Cream is Serraca indicum. It tends to have an anti-inflammatory property, and it also helps to desensitize inflammatory pain as a result of burns and wounds. Also, we have Sesamum indicum, the popular sesamum seed oil. It has antioxidant properties, and it also has a moisturizing effect on the skin. Then we have licorice. Licorice also is very, very effective in providing emollient effect, which is a moisturizing action. So all of these ingredients combine together to give Borocare Neem Cream its action, its myriad of activities. This makes Borocare Neem Cream. Okay. This makes Borocare Neem Cream an effective antimicrobial cream, an anti-inflammatory cream, an antiseptic cream, an astringent cream, and an effective wound healing cream. And another thing Borocare has is zinc oxide. Zinc oxide also has been shown to have astringent effect. That is, it helps in itching, reducing itching, and also some other inflammatory conditions. So this is a summary of some of the activities of Borocare Neem Cream. It's effective on dry and cracked skin, on minor sunburn, on cuts and wounds, nappy rashes, skin inflammation, and it also has moisturizing action. So each of the herbal ingredients have active constituents, which gives Borocare Neem Cream its efficacy. Like talking about the neem plant, which is the popular dongoyaro, it has azadirachtin and melantriol. This makes Borocare an effective antimicrobial agent. So it possesses a wide spectrum of activities against both gram-positive and gram-negative bacteria. Then aside from that, it's also effective in wound healing. A lot of our customers have used this product and they have also testified. I was at the National Association of Dermatologists Conference in Port Harcourt, and a lot of dermatologists commended the brand, which they've used it on first and second degree burns. They've also used it on treatment of different kinds of wounds, and they attest to the fact that it's very effective. So one of the effects of the neem plant is it increased the proliferation of fibroblasts into myofibroblasts. As a result, there is increase in tensile strength of an inflamed wound area. As a result, that wound healing action is enhanced. Next slide. Also, aloe vera. Aloe vera, very effective in first and second degree burn. The active constituent in aloe vera is allium. Allium has been shown to be very effective in burns and also in inflammatory conditions. Also, it soothes rashes and skin irritation. Wow. Okay. Then sesamum seed oil has two chemical constituents called sesamine and sesamolene. So very effective antioxidant and emollient activity. Then we have licorice. I've also said that. So it's very useful antiseptic anti-inflammatory properties. Then I've spoken about Serraca indica, very effective in inflammation and also reducing pain during inflammatory wound condition. Then zinc oxide helps in wound healing, skin irritation, and itchy condition. So in summary, why should you use Boroke neem cream? Very effective in first and second degree burns, moisturizes and soothes the skin, antibacterial action. It's also a first aid cream, so you must have it in your home. When your kids have wound issues, burns, and some other condition, it's very important that every home should have Boroke neem cream. Also in your pharmacy, Boroke neem cream should be part of your first aid kits. Promote healing of wounds with functional and cosmetic results. So one unique thing about Boroke neem cream is that when you have wounds and you use Boroke neem cream, the incidence of scar formation after healing is reduced. Then it's also effective on insect bites and itchy condition. So on using Boroke neem cream, you clean the area, apply copious amounts on that area, then you massage gently so that the ingredients can penetrate into the skin. Okay, so thank you very much. So I believe you would prescribe Boroke neem cream to your patient and also use it. Thank you.
Thank you very much, Oswald Pharmacy. A round of applause for them. We'll be inviting now Enlumi Data. Enlumi Data, are you ready? All right, a round of applause for them as they come forward. Please, you have just 5 minutes.
Please, before we do that, please, community pharmacists in the house, we have the young ones working on a project. I guess they've circulated the project questionnaire. Kindly help fill and let's make the profession better by making sure we bring up younger ones with data-based experience and knowledge. Thank you as you do this.
Good afternoon, mommies and daddies. It's my pleasure to be here today. My name is Taiwo Bokwola. I'm the Business Development Manager with Enlumi Data. Enlumi Data, we are a software technology organization, and we provide tools that power your business. At Enlumi Data, so, Enlumi Data, we are a software technology firm, so we provide tools that help your business. Basically, what we do at Enlumi Data today is to provide tools that connect with every side of a business, from payment processing to managing your customers, staff, inventory, and more. At Enlumi Data, our solution for business is called Lumi Business. So we have inventory management for your business. We understand today that many businesses, they are having issues in terms of stock control, minimum order quantity. At what point do I need to restock my store? At what point do I need to know that, oh, this particular drug or item is about to expire? So with our inventory solution today, you can easily manage and track your inventory. You can easily manage what is being sold at your respective pharmacy store every day. So that's with our inventory solution. Also, we have banking solution for your business. With our solution today, you can create unlimited corporate account in 10 minutes. So let's say, for example, you want to have multiple accounts, so an account for operations, an account for payment of staff salaries. This you can do with our banking solution today. So you don't have to be present at your business space. Anywhere you are in the world, you have control over your business, from payment processing, inventory, payment, receivables. Also, you can pay your staff and vendors on our platform today. You can also manage all your corporate accounts on a single platform. Accepting payment at your store. We understand that today, in many businesses, they have issues with receiving payment from customers, most especially in terms of transfer, POS delay, failure rates. But with our solution today, our POS is one of the best in the market. So with our POS, you can easily process payments instantly from your customers. Then we also have loyalty for your business. So you can reward your customers, and research shows that when customers are rewarded, it brings about repeated purchase, customer retention. Thank you.
Thank you very much, Illumidata. We move straight to, thank God we are still in the morning. What's the time? It's morning. Great. Please join me to welcome the chairman of the occasion, pharmacist Mrs. Stella Okoli, FPSN ON, Managing Director, Chief Executive Officer of MZO Group of Industries, represented this day by pharmacist Mrs. Ezeoke, the Executive Director General, MZO Group of Industries. A round of applause for her as she gives her remarks.
I suppose I should say good morning. Good afternoon. To one and all, I will ask to stand on the wonderful protocols. Famiola, the protocol was so wonderful. I think you covered everybody, including family members, I heard. So with your permission and with regard to the time, I'll just go right in. I'm representing the official chairperson of the occasion, and that would be Dr. Stella Okoli. I actually had hoped she would be here by this stage, so I reached out to her to ask what she would have said if she was here. She's not one that ever reads a speech. She always insists that one is prepared, but she always speaks from the heart and from experience. So after she told me in a nutshell what she thinks she would say, it's always evolving, it took me back to an experience I had about 2 months ago. It was about 7:30 in the morning. I was on my way to the office, and I looked up just as a billboard was coming up, and it was one of these leadership motivational seminars that was directed towards women. And it was a digital board, so different things were coming across. And as I looked up, the phrase, "she can do more," came up. Now, I don't know what time I went to sleep the day before, and I know I had a lot I was thinking about in the coming day. And I just said, she can't do anymore. She's tired. She doesn't want to do anymore. And I remembered that this morning because when I asked Dr. Okoli, what would you say? She said, tell them to do more. So it shows that everything hangs on your attitude and everything hangs on what you've decided to do. I want to draw our attention. Because I told her, or rather reminded her, because she said, this is the API one, right? And I said, yes. And I reminded her of the theme, innovative approach towards ensuring medicine security, the place of local production of active pharmaceutical ingredients in Nigeria. When I look at things, usually one or two words will rise above the rest. And the ones that jumped out that I talked to her about was innovative, approach, and place. So just very briefly, if she's saying do more, I think the first place where we do more is in our thinking. Innovation we think of as coming up with new ideas, doing something that hasn't been done before. But, sometimes that can be really, it can be intimidating. So many pharmacy conferences, whether it's NAIP, they're preceded by describing the environment, how to thrive in a declining economy, in a volatile economy. A lot of negativity is out there. So it begins with the thinking. If we've agreed, have we agreed to do more? Little bit more or a lot more? Everybody knows themselves. For some of us, all we can do today is a little bit more, but it means everything. So once you've decided you want to do more, you don't have to reinvent the wheel. It might just be time to change the tires, and that's a little new thing that you do today. So you're still in your space that you occupy and have the power to change, but you decide to do a few things differently. For some, not everybody is going to manufacture APIs this year. But what are APIs used for? Is it not making finished products? And if we get a vibrant API industry in Nigeria, who is going to predominantly buy these APIs? Is it likely to be local manufacturers or international companies? Local manufacturers. So can we do a bit more today? I'm going to challenge every community pharmacist, every chance I get. Go back and ask yourself, this local economy that we're saying we need to support, what's my ratio? Because you should challenge yourself to know, to what extent do I purchase locally manufactured drugs when they are available? So please let that be the little more that we all decide to go and do. Then secondly, the other word there was approach. And that only has to do with how you decide to move. You've decided, I want to do more, and I want to move. So it's just a case of deciding how you want to do it. But take a decision. The last word was place. We have to decide, where are we going? That's another conference theme. They'll give you a problem, and they'll say, Nigeria, where are we? Or the group, where are we going? I think it's not an arbitrary question. You must decide to be somewhere different from where you are today. A lot of questions, a lot of thinking. But my challenge is pick something small, because that's how change happens. There was a verse of scripture that I was reading, and I read it in a new way. My mind approached this truth in a different way, although it was not something new to me. And it comes from the book of Isaiah. And I don't tend to apologize if I use scripture. It's part of my approach. It's the way that I move. Whether I always do everything it says, that's another conversation. So bear with me as we get to know one another. And it says, whether you turn to the right or to the left, your ears will hear a voice behind you. I never noticed that behind before. It's there, but I never paid attention to it. And the voice will say, this is the way, walk in it. So I'm saying none of us are allowed to hold space in the same space. It's actually a lie. Everything around you is moving. So if you stand still, you're being moved by something else that is moving. So whether you decide to go to the right or the left, there's no judgment there. It doesn't say as you go to the right, because it's predestined, or as you go to the left. It just says as you move instruction will come. And it comes from behind because you've got to take it by faith. You have to do some things that don't make sense at the time. You have to begin a project for which you don't have the money. You have to look at a different and innovative way of raising money. And thank you to GSK, thank you to Pfizer, thank you to EMZO, so that we can do these things. But it would be great if we can even do crowdfunding amongst ourselves when we need to pull off an event. You know, you don't want Ogakule here to develop donor fatigue because all the requests are coming. So whatever you decide to do, know you're going to have to do it in faith, but also trust that as you move, and it only happens when you move, support will come, confirmation of your inspiration will come, and strength will come. Because now when I see she can do more, I tell myself, yes, she kind of has to do more. There's no luxury of saying she can't, she's tired. There's just too much work to do. So Dr. Stella Okoli is asking us all to do more. She's not here today because she's doing more in another place today. So I really thank you, and I really look forward to the rest of the day. Thank you.
Yes, can we do a little more round of applause? A little bit more, a little more, a bit more, a bit more bit. Thank you very much. Thank you very much. That's very inspiring. Thank you very much. And we're going to be hearing a little more from them still as we welcome EMZO Group of Industries, ably represented by their channel marketing manager, Mr. Ndubuka Emmanuel. Can we give him a round of applause as he channelizes his presentation?
The chairman of the occasion, who happens to be my GMD, the PSN chairman, distinguished pharmacist, you will agree with me that the event of COVID that happened last year has posed a lot of challenge to us. And it is on this note that EMZO Pharmaceuticals will be doing this presentation today. We've come to discover that import substitution is the only means right now to medicine security in Nigeria. My name is Ndubuka Emmanuel, and we welcome you to the home of unlimited wellness, EMZO Pharmaceuticals. We have the faculty of sight to be the leading pharmaceutical industry in Africa, not just in Nigeria. And this is how we have fared over the years. Over 40 years of legacy, 200 plus products from about 25 therapeutic classes, and then 4 factories in Nigeria. One of our most recent factories right now is in Shagamu, and I'll be telling you much more about that. Thank you. That's to the GMD. Thank you. You can do that better. Thank you. Thank you. And while my EDG was presenting, I saw the PSN chairman with so much rapt attention. For that reason, you're going to get a T-shirt now, sir. And for everyone that pays attention to, I'll be throwing out 1 or 2 questions, and then you'll get something before we leave here. Yeah, thank you. This is our voyage over the years. This is how we have fed. We started in 1977, and it just started with a small pharmacy shop here in Lagos. And then from 1977, 1984, it became a pharmaceutical company. And then in 1988, paracetamol was launched. 1993, we expanded, got into production. And in 1999, our factory expanded. And from 2018 till date, we have 4 factories in Nigeria. 4. One of them, if you may need to know, is a WHO standard factory in Shagamu, the only factory in West Africa right now that has a cephalosporin plant. So from this, you will see that Emzo has come of age. And right now, it's not just the Emzo Pharmaceuticals that many of us know. We have Emzo Hesco, we have Emzo Vaccine. There was a master class here yesterday. And then while the master class was going on, we discovered that about half of the people here today have been vaccinated, have received the hepatitis B vaccination. So on this note still, once this section is over, there's going to be a free hepatitis B screening out there. And then the vaccination will also come at a discounted price. We have Emzo Vaccine, we have Emzo Hesco, that's our medical equipment. And then we have Zolon, it's another arm of Emzo, a sister company. And then Emzo Pharmaceuticals that we know. Now for the vaccine, the Hesco. It's a one-stop shop for our medical equipment. And then we have brought a very beautiful offer to the table to say that you can have flexible payments. You can buy our medical equipment and furnitures at a very flexible payment pattern, buy and pay by installment. And I'm sure you'll like that with this present economy. Don't worry, we won't charge you extra. Okay, after sales service, biomedical engineering, and in a very discounted price as well. So these are some of the things, the furnitures and hospital equipment that we offer, and much more than this. Medical imaging, theater, ICU solution, and the rest of them. This is our journey of import substitution. What really spurred us up to say, let's get into import substitution? COVID-19 was an eye-opener. There was scarcity of pharmaceutical products. We depended on the Western world to give us active pharmaceutical ingredients. We didn't have buffer stock and the rest of it. And so it became a big challenge. A lot of people were just, limited to the Me Too brands that they wouldn't ordinarily want to use before because of treatment failure and the rest. But everybody was just, limited to what was available. And so we're saying, compared to other countries in the world, India, as it stands right now, has 10,000 drug manufacturers for 1.4 billion people. And then this is China, 500 drug manufacturers for 1.4. Africa just has a paltry sum, 375 drug manufacturers for 1.1 billion. And in Nigeria, 115 drug manufacturers, registered pharmaceutical manufacturers for over 200 million people. So while Nigeria has 2 million drug manufacturers for, one drug manufacturer for 2 million people, India has about 140 drug manufacturers. One drug manufacturer, 440,000 drug manufacturers, for their population. So we're saying import substitution is the way. The question today is, what would happen if there is another pandemic? Somebody will say, God forbid. I agree with you. Should there be another pandemic, what would happen? Would we have learned from the first one? Or would we still go out there and still depend on the Western world for APIs, for pharmaceutical products, and then when the dollar dwindles, we run short of products, no buffer stock and the rest. So this has informed, our drive to say, let's see how we can, bridge this gap of import substitution. Let's produce locally. Let's manufacture here. And you see how far we have gone and what we intend to do. These are some of the benefits that we could derive: health, security, quality and available, affordable medicine, tech transfer, research development, economic growth, employment, and the rest of them. So you'll agree with me that it is very important to say, let's consider this. Just a glimpse of what you have at our Shagamu factory. World standard, WHO standard manufacturing factory here in Nigeria. This is just a clip of it. I've been there personally, and it is mind-blowing. The last time we met with the Commissioner for Health, he said he would personally want to be there. And then you could also make out time, and then we'll take you there as well, so that you see that when it's not just mere rhetorics, we say and we do. That's right. So these are some of the things we have there. Oral solid dose plant, cephalosporin plant. And then we intend coming up with intravenous fluid, IV plant. We have the beta-lactam plant already. And it has its own gas power plant. We don't depend on HPA, NEPA. So we have a gas power plant. We power light ourselves. No interruptions and that. And we try to stay true to regulatory procedures. Now, this is Zolon. Some of the products that we produce from the Shagamu factory. I'll just run through them. Glimepiride, rosuvastatin, azithromycin. These are products that we used to import before. Misoprostol, but right now we're no longer importing them. Thank you. So I didn't mention the Emzo vaccine. So after this section, you can just go out there, do your free screening, and then get vaccinated for a discounted price. For Emzo Pharmaceuticals, different ranges of products. I won't bore you with this. But I'll just point out there that a very unique product there, among the cardiovascular products, Emprin 75. A lot of people here today will benefit from Emprin 75. If you're 40 and above, raise your hands. Not to worry. You will get a free card of Emprin 75 here before you leave after my presentation. You get a free card. Okay, so from Emzo paracetamol, our flagship product, we have advanced. The first to come up with a combination of Locmal, that's artemether lumefantrine, in combination with paracetamol. You don't have to buy paracetamol to get a complete malaria treatment. And then to also cushion the burden of pill loads, we've compressed the 2 tablets, 500 milligrams paracetamol to just one single tablet, Para 1000, for convenience. So these are some of them. In addition as well, you're going to get Para 1000 here today before you leave. Yes. Yes, you will. You will. You will. Celecoxib, piroxicam, nystatin, fluconazole. These are all the products we used to import before. But no more are we going to import them. We're now going to locally manufacture them here. In September 2012, UN pointed out 13 life-saving commodities to prevent maternal and infant mortality. Out of those 13 life-saving commodities, Emzo currently has 6 of them. Time will not permit me to just run through them. But as I round off on this slide, this is a very important point to note. Emzo is the first company in West Africa that would soon produce active pharmaceutical ingredients. No more importation. No more importation. This is my final slide. But I want to ask, if you have somebody that would benefit from low-dose aspirin, from what you have heard today, what would you recommend? The first hand to go up gets a T-shirt. 1, 2, 3, 4, 5, 6, 7, 8, 10 T-shirts, 10 buckets for everybody seated. No, not for everybody, for 10 people. Thank you for taking time to listen.
Thank you very much, Emzo. A round of applause for them. Emzo doing not a little bit more, doing much, much more. A round of applause for them. Thank you very much. All right, before we go ahead, I would like to recognize in our midst the current head of the department, Pharmacy Luth, Pharmacist Lola Olufounsi. A round of applause for her. She's right here in our midst. Thank you very much.
Very certain, some will collect t-shirts, some will collect flyers, some will collect stickers, some will collect pen, some will not collect anything. When they walk in, Emzo, you have innovated this room. Disruptive innovation. When he walked in majestically and with the aura of an emerging Kabiyesi. Who am I talking about? Pharmacist Adewale Oladigbolu, FPSN National Chairman, ACPN. You're welcome, sir. Now we move quickly as we welcome the chairman, the special guest of honor for today, Pharmacist Patrick Aja, MAW, to give his remarks. Managing Director, CEO, May and Baker PLC. Please, with a resounding applause, let's welcome him to the podium. I guess he also needs Empirine. Patrick, do you need Empirine? I know you can't touch Empirine for now.
Thank you. Thank you so much. Please permit me to stand on the existing protocol. And I really want to thank my chairman for this great privilege. And I sincerely want to appreciate PSN Lagos. I'm one of the products of PSN Lagos. I think that deserves a round of applause. And when I see this table here, these are men that inspired us way back when we were in the university. I say that because right from the time of our late senior brother, Jimmy Adesoyan, I was a student, the PAN's president. And the kind of reception they used to give me at Olatunji House has lived with me for a long time. Please, can we put our hands together for these great men? And the inspiration about pharmacy, and I may bold to say this. There is no other profession that is like the pharmacy profession. They hold you by the hand before you get into the university, through the university, and when you come out. So it's a great privilege. I started by being an MC. As a student, they bring me to MC PSM functions, and I keep following these men. Our father, Family Lucy. It's amazing. It's amazing that before our very eyes, we could see what these great men had done. I remember then, they used to tell him, he will send people to go and buy me snacks and mineral. And I was a student and I was wondering, how could they be doing this? So I want to thank all of you. I want to thank my chairman. I want to thank the fellows that are here for this great opportunity. I was asking my chairman, who are the people who are going to be here that you are inviting me to sit on this table? And he persuaded me to sit. I like to say, I do not deserve this. I do not deserve this, but I just appreciate that I can get a chance to sit with all of you on the same table. Thank you so much. It's been a wonderful time already, and we're still going to have more. My brother Kunle is going to do a fantastic job, and I've made bold to say, nobody can love you more than yourself. Nobody. COVID has taught us that. No matter how much they love you. I've been with multinational companies, many of them. When the going gets rough, they pack and go. But where are we going? We are here. We are going to support our own. We are going to be great in this country. And I have said, Emzo, produce the API. We are going to support you. Nobody can love you more than yourself. Thank you so much. It's a great pleasure to be here.
Thank you very much. That was brief and smart. A round of applause for him. Thank you. All right now we'll be also inviting our guest of honor, our own very registrar, and the person of pharmacist Baba Shehu, FPSN, also FPCP Farm, Registrar of Pharmacy Council of Nigeria. A round of applause for our registrar as he comes forward. Thank you very much, sir.
Good afternoon, all. I don't want to make the mistake of saying good morning. Looking at the background I come from and recognizing the fact that so much time has been spent, I still want to seek the indulgence of the audience to permit me, even if it's going to be in abridged form, to recognize in a special way by way of taking through little of the protocol. Because to whom honor is due, I think it's just appropriate that you give it. I'll be brief and very swift in taking it through. I'm specially and uniquely happy to be here today to participate in the 2022 Scientific Week of the PSN Lagos, something I look forward to since my assumption, because I do know that if we are able to interact very well here, we'll be able to also have a good direction in steering the ship that God has given us the mandate to do. I want to especially recognize the president of the PSN, who is ably represented by the National Treasurer, the chairman of the occasion, our guest of honor, the chairman of PSN Lagos, our keynote speaker, all the past chairmen and leaders of pharmacy profession in Lagos State, fellows of the PSN. Permit me to also recognize members of the Governing Council of PSN. The DPS Lagos is here. The Dean of Unilag Pharmacy faculty is also here. I also recognize the Commissioner of Police. We also have two other DPSs here. We also have the Director R&R of our sister regulatory agency and very distinguished participants. I'm happy to be here, and I bring felicitations from the management and staff of the Pharmacists Council of Nigeria to the leadership of PSN Lagos, and indeed to the executive committee, to the members of the conference planning committee, and entire body of the pharmacists in Lagos. I want to appreciate PSN Lagos for what they have always been, which is taking the lead in the struggle of moving the pharmacy profession to greater heights. Let me stop here, but most importantly inform us that the new Pharmacy Council of Nigeria 2022 Act is now with us, and we are set to implement it. We have achieved the Gazette. We have deposited it at the Supreme Court this week. We are also going to deposit at other arms of the judiciary, the Court of Appeal, and the High Court. And from there, we are ready to go on with implementation. In doing so, there is going to be effective engagement and sensitization of the pharmacy workforce as well as the general public. I congratulate us all for this achievement. Thank you, and God bless us all.
Thank you very much, sir. Let's keep clapping for our own registrar. All right, because of our time, we'll be taking just one goodwill message, and that will be taken by our national ACPN president, pharmacist, chairman, sorry. Thank you. A round of applause for pharmacist Oladibolo as he comes forward. Thank you very much, sir.
Thank you very much, and a very good afternoon to all of us. Yesterday, I was in Oshogbo, and I gave a keynote address at the pharmacy week there. And here we are today, talking to Lagos people again. And just that yesterday again, I had a dream, and I was being asked to define Lagos pharmaceutically. And I asked myself, how do I define a state that has 40% of the total population of pharmacies in Nigeria? And I asked myself again, how do I define a state that is the fulcrum of pharmaceutical activism in Nigeria? A state that has the like of ABO, a state with the likes of Olumide Akitayo, and a state with a giant pharmaceutical company like Emzor. How do I define such states? It's on this note that I would like to say a very big congratulations to the Lagos State Chairman of PSN, and I would like to say a very big congratulations to all members of Lagos PSN. Lagos is a beautiful state, but I'm learning a new thing from Lagos State. From Magboro to this place took me 5 hours this morning. That is a great point to know. So thank you to all the giant people in pharmacy, the people we look up to, the who is who in pharmaceutical world and in Lagos State. So a very big thank you. We appreciate you a lot. Keep innovating. Keep leading the rest of the pack, because without Lagos innovating and making progress, indeed, pharmacy in Nigeria is at peril. Thank you, and a very big congratulations.
Thank you very much, sir. A round of applause. All right, so.
Sir, can I assure you, when you're going back, it will take you more than 30 minutes. Let's welcome a friend of the house, the Commissioner of Police, ably represented by ACP Tijani Olukemi, for her remarks. Okay, sorry, slip of tongue. For his remarks by her remarks. Am I correct? Okay.
Is it good morning or good afternoon? Good morning, ladies and gentlemen. Permit me to stand on the existing protocol. I am ACP Olukemi Tijani. I'm the Assistant Commissioner of Police in charge of Escort, Lagos State Police Command. I'm here to represent my Commissioner of Police, CP Abiodun Sylvester Alabi. He will have been here, but due to exigency of duties, he's not here, and apology for that. As we all know, this is a scientific week of Lagos State Pharmaceutical System of Society of Nigeria. The annual event structure for the attainment of the following of the objective: enlightening the public on healthcare issues, enhancing the corporate image and public perspective of a pharmacy and a pharmacist at all times, focusing on progress made in all spectra of pharmaceutical endeavors. On behalf of my Commissioner of Police, I want to sincerely commend the Pharmaceutical Society of Nigeria Lagos State Chapter for putting on an event of this magnitude with together with the team, innovative approach towards ensuring medicine security, the place of local active pharmaceutical ingredient production in Nigeria. This is so timely. There couldn't have been a better time, and the Nigeria Police Lagos State Command is a partner in progress. And once again, I appreciate you, and God will continue to bless it and every one of us. And once again, Nigeria Police is your friend. Continue to. Please, we are your friend. Continue to support us so that we serve you better.
ACP ma, I want to greet you the police way. PCRC ma. Service to the nation, PCRC. Thank you very much. So we are friends. Police is your friend. If education is expensive, what next?
All right, we'll be taking the pharmacy anthem right now, and we'll be inviting the best choir in the whole wide world, the Alps Choir, anchored by our own very mommy, pharmacist Mrs. Adeniro. So all the Alpians in the house, please step forward, and all pharmacists who will be upstanding. No, all pharmacists upstanding, while some of the Alpians step forward. Okay, some, okay. No, the Alpians choir, they know themselves, the ones that are in the choir. Yeah, please, let's step forward. And our choir leader, pharmacist Mrs. Adeniro. Thank you.
And I am the assistant choir master.
Thank you.
Come see. Page 4.
We did the answers the other time.
Let's do sideways so you can accommodate me.
I want to
Are we ready?
They are upstanding. One to go. We pharmacists, we are proud of pharmacy. We members all of the glorious PSN, Pharmaceutical Society of Nigeria. As men of honor, we join hands for pharmacy. Pharmacy. We are there. Health sector. We are there. Industry. We are there. Education. We are there. The last stanza. We pharmacists, we are for cooperation with members of our great nation's team. Say pharmacists, we guard our nation's health, and we prove pharmacy can hold its own everywhere. Pharmacy, we are there. Industry, we are there. Health sector, we are there. We name we are Nigerians. We are Thank you very much.
Thank you very much, Mas, and thank you very much, Apps. A round of applause for them. Please, important notice. Please, important notice. The choir practice holds on Saturday, 2 p.m.
I'm sure you agree with me that that's the best choir. A round of applause again for Alpians. Up, Alps.
You know, it is songs like this you use to bring up the president of PSN. Am I right? We use the pharmacy anthem to bring up the president of PSN. So please, let's be upstanding as we welcome the president of PSN to give us his remarks, represented by the national treasurer, our own pharmacist, Gafar Madein, FPSN. Thank you very much, everybody. President, sir.
Thank you. Thank you. Please permit me to skip the protocols. Permit me to skip the protocols because I know that our time is fast spent, and I go directly to President's message. First, President will have been here today, but it's very painful to him that he could not make it due to human exigencies. As you are all aware, the FIP Congress as well as NAPSA annual convention, just ended on Sunday. And, he traveled to Tampa, Florida, coming back to Nigeria on Tuesday night. That was day for yesterday. So, and he had to go to Benin, to attend to some, family needs. So, based on that, he was not able to come here today, even though he would have loved to be here. And he told me that I should let you know that he owed Lagos State PSN in high esteem, because he knows that there is no way he can succeed as PSN president without the support of Lagos State PSN. And also, he asked me to tell you that he is very happy and grateful that since he came in, November last year, he has been getting support of Lagos State PSN. And he wants you to continue supporting him so that he can succeed in taking the society to greater heights. Having said that, he recognizes that the theme of this pharmacy week, innovative approach towards achieving medicine security, is very, very apt. And is even in rhyme with the theme of the PSN National Conference that we're having this October 31st, starting October 31st, which is medicine security in an unstable economy. So we are speaking the same language, and we are having the same focus, medicine security. Because you agree with me that just like food, medicine is one of the physiological needs of human being. Because, like Obafemi once said, that no matter how you take care of your health, you do all these health tips and rest like that, you will still fall sick one day. And what you need to take is medicine, the appropriate medicine. So the focus is very, very commendable that we are focusing on medicine security in Nigeria today based on our past experiences. And again, he asked me to remind you that he's ready to receive you in Jos, October 31st, for the annual national conference coming up. And it's going to be very exciting. The table is prepared. Everything to enjoy the conference has been prepared. So it is now left for you to come, because he recognizes that even in past conferences, Lagos State delegates is always the highest, even more than the hosting states. So, and he still wants it to repeat this year. So please endeavor to be part of the CIAS conference. So let me stop here, and also to congratulate us, for the achievement of having the Pharmacy Act signed into law by the president. And also for the God's grace in giving us a thoroughbred professional, somebody who loves the profession and has shown it as the new registrar of PCN. So that the two are happening about the same time. The brand new registrar and the pharmacy bill 2022, is already showing, and also we are discussing medicine security. It shows us that the future is very bright for pharmacy. Thank you very much.
We thank the president for that wonderful speech. A round of applause again for our president. Let's give him a presidential applause. Quickly, I want to invite a friend of mine, a classmate, Shakirat Ajalaruru. Oh, sorry. Oh. I forgot that somebody has paid the dues. She used to be a Shakirat Ajalaruru. We were very wonderful friends. She has a duty to perform this afternoon. She'll be reading the citation. Okay. Shakirat Adioshun, MAW, DPS, Primary Healthcare Board, Lagos State, Ministry of Health, Lagos, Nigeria. Let's welcome her quickly. Abs, you are not clapping. I will clap on your behalf now.
Charlie, I'm not surprised. You've always been a handful right from school. Good afternoon, distinguished ladies and gentlemen. Permit me to stand on existing protocols. I also want to beg everyone here for my very, very croaky voice. But with great honor and privilege, I'd like to respectfully invite the keynote speaker to the podium, sir, while I read his citation. Our keynote speaker, pharmacist Kunle Oyelano, FPSN, is the managing director, GSK Pharmaceuticals PLC. Kunle Oyelano is the group managing director of GlaxoSmithKline GSK Nigerian PLC. He brings over 2 decades worth of experience in the healthcare, pharmaceutical, manufacturing, and FMCG industries, where he has a track record of providing leadership, building businesses, and accelerating growth, transforming culture, strengthening governance, and developing talent in the roles of increasing responsibilities across Nigeria, Africa, and Asia. Kunle is a visionary and strategic leader who is able to pay attention to details whilst keeping in view and continuously fine-tuning a big picture orientation. He has demonstrated success in the development and effective execution of robust business strategies, consistent governance, and building relationships in the diverse markets and multiple industries. Over the years, Kunle has provided exemplary leadership in achieving sustainable results and preferring solutions in different business conditions, including startup, acceleration, and turnaround scenarios. Currently, he is leading the growth and sustainability of the business of GSK Group in Nigeria, whilst further embedding global best practices within the company. At the moment, he's leading one of the largest tech transfers from a global multinational to the local industry. Previously, as a commercial director for GlaxoSmithKline in Africa and developing countries of Asia, he ensured prioritization and focus on key growth drivers and enablers and provided stimulus for the over 40 countries in the regions to achieve objectives. As Marketing and Commercial Excellence Director for Nigeria, West Africa, and previously Kenya, East Africa, he led the rapid development of innovative strategies, effective utilization of multiple channels, and external collaborations to deliver exceptional engagement and development of new markets. Kunle has a strong focus and drive to deliver outstanding business performance while strengthening controls and positively influencing the larger society. Kunle values inclusion, diversity, and multicultural perspectives. At various times in his career, he has lived and worked across all parts of Nigeria in the East, West, and South Africa, Asia, and Europe. He advocates for and supports not-for-profit initiatives that seeks to strengthen youth and civic development with a focus on leadership, business, and entrepreneurship, health education, and faith-based initiatives. He holds a Bachelor of Pharmacy and an MBA from Obafemi Awolowo University in Nigeria. From Obafemi Awolowo University in Nigeria. He is also an alumnus of Strathmore Business School in Kenya and of the International Institute of Management Development, IMD, in Lausanne, Switzerland. Kunle Oyelano is the first vice president of NECA, that's the Nigerian Employers Consultative Association. He is an avid runner and a voracious reader. He is happily married and blessed with children. I present to you pharmacist Kunle Oyelano, FPSN, Managing Director, JSK Pharmaceuticals PLC. You're welcome, sir.
Good morning. The president of PSN, very ably represented by the National Treasurer. Our chairman, Dr. Mrs. Stella Okoli, very ably represented by Uzoma Ezeoke. Good afternoon. To our chief host, to chairman of Lagos State PSN, also good afternoon to the registrar of the Pharmacist Council of Nigeria, Pharmacy Council of Nigeria, Ahmed Babashiu. Afternoon, sir. And of course, all our very distinguished members of the high table, all the very senior persons here, especially the chairman, the newly just considered chairman of the Council of Former Chairmen of Lagos State PSN, or Forum of Former Chairmen of Lagos State. Good afternoon. And every other person. But if you just permit me specially, I need to recognize 3 other persons here. I thought for a while I saw Mr. Kayode Ayegbajeje. He's there. Mr. Cool. I need to recognize him. When I started my pharmacy career about 30 years ago, he was my first manager in General Hospital Lagos. I honor you, sir. It was my when as an NYC corporate then, it was my leader there. Thank you very much, sir. I also noticed Mrs. Fuluke Akiniroye, Mrs. Dayo Adetola. They were my senior colleagues in the organization that I have the privilege to lead now. Thank you very much for setting the right path.
I also salute all very distinguished fellows of our beloved profession and all other senior colleagues and distinguished ladies and gentlemen. Let me first start by congratulating Lagos State as has been said, a pace-setter state in many, many things in PSN, virtually everything in PSN. Lagos State consistently raises the bar of excellence when it comes to pharmacy activities. And I also know that the state also, as it were, is very, very strong on professionalism. Many of us have attended the master classes yesterday will know that it was indeed a master class organized by the state. Thank you very, very much for that. And I also want to thank my own very beloved sister, Mrs. Titi Onedo, for inviting me and to the chairman for agreeing to this occasion. I'm told I have 30 minutes to speak about this. I've already spent 1 minute. So I have 29 more minutes for this. If the presentation could come on. Okay, good. Thank you very much. And if you could move to the next slide. Oh, okay, it's fine. Next slide, yes. I'm actually very pleased with this theme for this particular year, the annual scientific week, because we're talking about the innovative approaches towards ensuring drug security in Nigeria, with specifics on the role of the place of local production of API in Nigeria. And I'm pleased for a number of reasons. Number one, because the theme is very timely and is germane for the season that we're in. I'm also pleased because as a GSK, as a key stakeholder in the pharmaceutical industry in Nigeria, let me remind us that whilst we're a global multinational, we are also very much a local company because we've been on the Nigerian Stock Exchange for the last 50 years. And we have over 100,000 Nigerian shareholders. And as a matter of fact, majority of our shares in Nigeria is owned by Nigerians. So one of the things I like to say is that we're a global company with a local DNA. And we always like to be part of whatever solution we grow and we improve the industry in Nigeria because we consider ourselves to be firmly embedded in the fabric of this industry that we've been in for the last 50 years, over 50 years. I think it was the chairman that mentioned that in Nigeria, we always like starting from where we are. And that's the same framework that I've adopted. We've condensed this, should be about 1 hour, but we've tried to condense it into 25 minutes. But the brief framework we're going to have there is just where we are, where we're going, and how we're going to get there when it comes to issues of drug security, especially the place of API production in Nigeria. And what we're sharing is not going to be a full detail of this. Like I mentioned, this is just a framework that should lead to more discussion. All right, let's define terms first before we go far ahead, so that we're very, very clear what exactly we're speaking to. And it's important that we have the same clear understanding of what drug security really means in the context of what we're talking about, what medicine security means. It actually means, in our context in Nigeria, that everyone in Nigeria, every patient, every clinic, every pharmacy, every healthcare worker, everyone that needs a medicine. Is that from here? Everyone that needs whatever medicine at any point in time is able to have full access to it when he or she wants it. So that equitable, accessible, and affordable medicines across the nation. And we've taken time to look at this definition because it aligns very, very closely with the number 3 Sustainable Development Goals, SDG 3, which seeks to provide universal health care for everyone across the world. Because basically we're looking at having healthy lives and promoting well-being for every age. That cannot be achieved without medicine security. I hope we are all very fully aligned on that. And there are many steps to that this drug security we're talking about that we just look at a brief framework of that. Universal healthcare coverage really should be where every one of us should be looking at. And again, I repeat that will only be possible when we have medicine security in Nigeria. And we'll look briefly at the role of APIs in that regard. Again, where exactly are we in terms of medicine security? What is the state of play? If we were to do an assessment at this point in time of medicine security, what's the current status before we exactly know where we are? Let me first define what good looks like, right? We want to have 70% local manufacture and maybe 30% import, because a time will never come when there are no imports. I mean, let's be very clear that there's no country in the world that is self-sufficient in medicines. So that's probably not an attainable goal. That is why drug security is what we should be aiming at. And that's one of the reasons why I'm particularly pleased that Lagos is looking at this. Universal healthcare coverage, where every Nigerian has healthcare to the pharmacists and other members of the healthcare profession. Where there's 100% access to medicine. If you need paracetamol for headache, you can get it. If you need an anti-malaria, it's available. If it's an oncology medicine that somebody that you know needs, it's also available, 100%. We also need to go beyond just thinking about our own sufficiency to look at, in reality, how can we develop the pharma industry in Nigeria such that it becomes a net earner of foreign exchange rather than a net consumer? And overall, how can we build the ecosystem, the pharmacy ecosystem, the pharmaceutical ecosystem in Nigeria, where it is as strong as it should be? I hope we agree, and we'll see why that our industry, the pharmaceutical ecosystem, actually is performing far below its capacity. So we need to think ecosystem, not just a particular line. And of course, within the manufacturers in Nigeria, what do we need to do to make sure that we produce international champions? And that is critical, because as of this moment, just to share some facts, as of this moment, no Nigerian company exports medicines to Europe. And there's a reason why that is. Any export we have is probably within the region of West Africa. Whereas, for instance, a country like India accounts for 40% of all the medicines used in the US. Why can't Nigeria take 2% of that from the manufacturing that we do here? So those are the things that we're going to look at very, very briefly. And of course, we need to make sure that we adopt global best practices. Our medicines will be acceptable everywhere, not when we comply with Nigerian standards. Not when we comply only with WHO standard, because that WHO standard is just the minimum starting point, minimum requirement. But in truth, when we have global standards, I had mentioned earlier that, and many of us will know that we're currently collaborating on a tech transfer with one of our local manufacturers. And if I'm to quote the leader of the organization, he said, "Kunle, what we've learned from the organization in the last 2 years, where you have done capacity building for us, money cannot buy it." That's the kind of value we bring to Nigeria, being a global company that has a strong presence in Nigeria. In the last 2 years, we've been on that journey of that tech transfer to one of our local companies. It's the capacity that we've built, the improvements we've brought in quality standards are impeccable, to an extent that probably for the first time, there will be an export from this country to a developed market. And that is the kind of value we have here. That is the vision. What is the reality? Currently, we are far from it. So the ratio, the proportion I want to pursue at this moment is an inverse. We currently have about 30% local manufacture. And I need to put a caveat on that 30% of local manufacture. Yes, 30% of the drugs here are manufactured here. But in reality, virtually 90% of the raw materials for that 30% is still imported. So if we were to look at it from a volume and a value perspective, we probably have about 15% of local manufacture. We're going to look at some of the reasons why. And imports, of course, constitutes the rest. Healthcare coverage is very, very poor, which is accounted for the fact that there was a study by the Federal Ministry of Health that in Nigeria, just about 30% of the 3.5 million people living with HIV have access to antiretrovirals. It's government-owned publication. So that's an indication of the kind of access to medicine that we have, which of course is an indication of the healthcare coverage that is not good enough. We're not quite set up for exports. And that's something that should be very concerning to every one of us. especially with AFCTA right at our doorsteps. How do we take full advantage of it when all the African borders will be open so that Nigeria is not left behind? So that we don't say, oh, we don't want imports from India, we don't want imports from Europe, and we get imports from other African countries. That will happen because we've signed up to that accord. So we need to be very intentional on what we want to do and how we want to achieve that drug security in Nigeria. And of course, there are no regional or international champions. Mention Nigeria in the scheme of things. No, to anybody outside the country, no drug manufacturer actually pops up immediately in a person's mind. Whereas mention India, a name will come up. Mention Bangladesh, a name will come up. Mention some other countries, mention Jordan, a name will come up. We don't have that yet. And that is the area where we should be going. Distinguished colleagues, I don't see this as a doom and gloom story. I actually see it as we have a lot of room to develop and to grow. And we're just starting on that journey where we should be. But let's ask ourselves briefly on why exactly are things the way they are? What is the current state of play that we have? Why is it like that? And in doing a root cause analysis for this, I would like all of us not to think in terms of different silos, but to think of a value chain. Because in reality, the entire pharma ecosystem is one chain. Whether we are seeing it or not as a chain, because we might be looking at it in different parts, but it's actually one chain, where one thing affects the other. And of course, the first part we need to look at our school that is the academia. It's the foundation of all that is done. And as the chairman mentioned, I think she quoted a scripture, if it also will permit me, if the foundation is not correct, not much can be built upon it. For example, when I left school 30 plus years ago, we had about 6 pharmacy schools in Nigeria. Currently, I'm told that we have about 25. So am I correct, sir? About 25, which is fine. It's a lot of improvement. We probably still don't have enough, considering that we're 200 million. But what we need to ask ourselves is that if we look across the entire chain, those schools of pharmacy, how modern and relevant is the curriculum? I was telling somebody sometime last week that while I was in school then, I spent a lot of time looking for trichomes and under microscopes and all that. Since I left school, I've not seen any I've not seen any trichome. I remember all those weighing balances in dispensing, all the things that we do in farm chem. We need to ask ourselves, how relevant are those things? Because in GSK, we increase the scope for our interns. So at any point in time, we have between 10 and 20 interns. And I get to interact with quite a number of them. And what surprises me is that the curriculum I had 30 years ago is not very different from what they have. It really should not be. And I want to believe that the committee of deans are actually looking at this and how to make the curriculum relevant to every other aspect of that chain. Let me pick, for instance, logistics. Which of course is the distribution of medicines, are we thinking, for example, of how to use blockchain in logistics? How to use RFID? Are those things being taught in school? There are African countries where in the pharmacy schools, they already offer a master's degree in regulatory affairs. I'm not aware that is in any of our schools here, but those are some of the things that we should look at. Let's look at the 8 steps of the chain and go back to the beginning and say, how do we prepare people coming out for every other step? I won't spend too much time here, but in terms of R&D, again, we need to ask ourselves, we're still talking about some of the hindrances to medicine security. In terms of R&D, there's probably not much happening. I'm aware of NIPRID, which does research, but there's not much products coming out in terms of full commercialization. Every pharmacy school, I believe, would have a drug production unit. What are the products? Where are the products that are coming out of those places? Those are the things that we need to look at. In terms of API manufacturing, we'll come back there. I know Emzo had mentioned that they will soon go into API manufacturing. We'll speak a bit of that. Product formulation, product manufacturing. There are about 150 manufacturers in Nigeria currently, from the latest estimate from NAFDAC. Out of those 150 manufacturers, how many do have the minimum WHO qualification? Probably 3 or 4 out of 150. Now let's leave a bit that WHO qualification. Out of the 150, how many of them have products that are WHO qualified? Maybe 2 or 3. Again, it tells us that there's a lot of room for us to grow in that area, and those are the things we'll be looking at. Do we have any company dedicated to just packaging and labeling, importing bulk? Imports, we have over 200 importers. How many of them are doing backward integration? Logistics, those are the distributors, people that move the products, the different centers, about 150. Again, what are the values that they're bringing? And importantly, at the end, the community pharmacy and the hospital pharmacies, we have about 40,000 if you combine all of them together. One thing I want to mention, which is, again, is as we go along, is important for the next 15 minutes as we go along. A lot of times when we discuss medicine security, and this is pretty important, a lot of times when we discuss medicine security, we tend to focus on the supply part, which is the first 7 elements there. And we ignore probably the most important part. That is the last step, the last mile, which is where demand is created. As long as the demand for medicines in Nigeria is suboptimal, as long as people do not, as long as we have 30% access to medicine, the ecosystem of pharmaceutical industry, the entire pharmacy ecosystem will not develop to its fullest potential. What is going to happen is that the very limited demand, the 30% demand at that end, is what everybody will be competing with. I mentioned it at times, and I think I've said it before, that our competition, we're not really competing with Emzor or with me and Baker or another company. Our competition are not other companies in Nigeria. Our competition, all of our competition is the poverty level in Nigeria. Because in truth, how many people can afford medicine, quality medicines? So whatever we're looking at should be tending towards how do we bring more people into the net, rather than patronizing all the people that are selling headpans about to buy genuine medicines in their community pharmacy or in their hospital pharmacy. And that is the only way we can grow the entire pharmacy ecosystem in Nigeria. And this is very, very important, right? Because the other part there are different stakeholders, governments, regulators, professional societies like PSN, and multilateral institutions. They are all part of that value chain. Now, the sum total of this value chain is that the Nigerian ecosystem is very small and underdeveloped compared with peers. For example, the contribution of pharmaceutical sales in all the pharmacies, in all the industries, from all the distributors to the GDP in Nigeria is about 0.2%, compared to about 1.9% in the US. And even for Malaysia, which is probably a much smaller country, about 7% contribution. What does that really mean? It means that if we grow that 2% to 0.5%, there'll be more sales in every pharmacy here. All the manufacturers will sell more. In the hospitals, there will be more medicines there. So those are some of the things we should focus on as we go on this path of medicine security. The other thing I want to highlight is the overall pharmaceutical sales in Nigeria in 2016. This is a survey by PwC that was done in 2017. It's less than $1 billion overall. If you look at the current exchange rate, it probably is still less than $1 billion. And that is for a country of 200 million people. Compared to Malaysia, population of Malaysia, if I'm correct, is about 33 million. And what they sell in terms of pharmaceutical, in terms of medicines, about 2.1 billion. Population of South Africa on the African continent is about 60 million. The size of the pharma market is about 3 billion. Let's even stop at that. Those are absolute figures. If we now compare the per capita, per head, Nigeria has one of the lowest drug consumption in the world. Which means that for every person that has, for example, a community pharmacy here, ideally, if we move to the level of Malaysia, in terms of per capita, you probably should be selling 10 times more than you're selling now. So what we really should be focusing on, it really is has to grow the entire ecosystem, the entire industry. And not, like I like to say, not all of us will be struggling over like two bald men struggling over a comb that they can't use. This entire system needs to be looked at in a different light. APIs. What exactly is the role of APIs? And we'll look at that just for the next 10 minutes before I end. Just to remind ourselves, I know we're all professionals here, but some of us left school 60 years ago, 50 years ago, and some of us left about 10 years ago, but still to bring everyone, to just as a reminder. Of course, the APIs are active pharmaceutical ingredients, right? For example, to make your paracetamol tablet, the API there is paracetamol acetaminophen. That is the active active. That's what they call, that is the active. That is the active pharmaceutical ingredient. There are many other excipients that go into making that. So you combine that together through your GMP, add some packaging, and voila, it becomes the paracetamol tablet that you know. Right? But let me take it a step further. Again, think value chain. Don't think of one particular thing. Let's look at what is the API for paracetamol and how does it come? I'm sure we all remember that that chemical equation from PharmChem. I hope we all remember. Where the starting ingredient for the API for paracetamol is phenol. And what do you do with that phenol? You nitrate it. When you nitrate it, you get two isomers. You get two different isomers. You get the para-aminophenol and the ortho-aminophenol. You separate the ortho because what you need is a para. And you do a process of purification and filtration. And again, you get your paracetamol. Very simple, right? And I'm sure we all remember. But the important thing to note here, again, if we look at the value chain that we're considering, the starting point for virtually every API is petroleum, is crude oil, the same crude oil that is imported, that is all over the country. That's the starting point for most APIs. In some very little instances, there's some natural sources, some plants are also sources of API. There's a reason why we're going through this value chain. Then from there, you get the base chemical. In this paracetamol example, for instance, the base chemical is phenol. And you process it, whether you do some chemical synthesis or biosynthesis, you get what I call the intermediates. And from the intermediates, you apply some further processes and you get the final API. Why? Let's talk briefly about numbers. The global API market as of 2019, which are the most recent figures. And it's important to first note that for any generic product, the cost of the API itself accounts for about 40 to 60% of the cost of the final drug. The API market in 2018 was worth almost $250 billion. Almost 250. That's the global API market worth almost $250 billion. And it's still rapidly growing by about 7%. To the extent that it will exceed 300 billion, maybe in the next year, in less than 10 years. There's a reason why we're going there. Currently, Nigeria's share of that market is 0. Of that huge pie of almost 300 billion, Nigeria's pie is 0. China, one country, accounts for about 30% of that 250 billion. If you do the math, and I want you to do the math, it means that currently, as of that 2019, China earned more from API than Nigeria earned from crude oil. Because in 2019, Nigeria probably earned about $40 billion from crude oil. China earned almost $100 billion from API. And by the way, we have more crude oil than China, right? And crude oil is the source for most APIs. So you begin to ask yourself, why? Why have we not unlocked that revenue stream for our beloved country to say we want to make APIs? We'll get there. India, there's a story here, because I want you to listen carefully. India supplies about 40% of the medicines, of the generic medicines in the US. But India gets about 70% of their API from China. It begins to tell us one thing. Number one, this issue of every country should be self-sufficient in medicines. It's not possible. But even the India that exports all over the world gets 70% of the API from China. But there's an interesting thing that happened in 2020. I'm sure we all remember the year that the world changed, when COVID happened. The interesting thing that happened there was that COVID started from Wuhan, China. The next province, please listen carefully, the next province that COVID went to was a province called Hubei in China. Hubei now so happened to be the biggest hub for the manufacturing for APIs in China. So when China locked down Hubei to prevent the spread of COVID, people started sensing that there's going to be a problem because we can't get APIs. 70% of the Indian API cannot come because the manufacturer's location is locked down. And India responded very, very quickly. What exactly did they do? I'm sure we remember some of these headlines. When push truly came to shove in 2020, it became every man for himself and God for us all. Those are some of the headlines we were seeing at that point in time. With one decree, one policy, India restricted the export of 28 APIs. Many of them, if I remember some of them, of course, paracetamol API was restricted. There were no exports. Acyclovir and antiviral was restricted. Erythromycin was restricted. Vitamin B6, B12, many of them were restricted for about 2 or 3 months. Not because there was a scarcity, by the way, but not because they sensed that China might not be able to supply. Those restrictions lasted for about 2 months, but it disrupted and distorted global trade because everyone went into a panic mode. In reality, there were probably really no shortages per se of these APIs because China soon resumed. But what caused it was more or less panic and panic buying. You remember that time when you were buying one small bottle of sanitizer for 10,000 naira? Right, that's what caused some of those things, because phenol is there. A lot of those things were restricted then. We also remember some of those headlines that we suddenly saw. It became a very hot topic because all over the world, people now realize that we need to look at how can we better do this thing. So that is the basis of what we want to just briefly look about in the next few minutes. I've said again that we are looking at a framework. So one of the key learnings for every country, not only Nigeria, is that truly, if you want drug security, which we have defined as not really self-sufficiency, but access and equity, you need to have some kind of API manufacturing to prevent against any unknown shocks that might come. We know that COVID is a one-in-a-century event, but who knows whether there be a geopolitical issue that might come anytime soon. Why then don't we have an API industry in Nigeria? Why is it not as it should be? I mean, we'll quickly look at the prerequisite for an API industry for active pharmaceutical ingredient. First one, of course, is we've seen that most API, 90% come from crude oil. And you need a viable petrochemical industry for that to happen. I know that we have LMA petrochemicals in Nigeria, but incidentally, it doesn't produce any petrochemical. So it's there in name, but not in reality. And I'm also not sure that the new refinery coming up in Lekki, whether it has a stream for petrochemicals, at least not at the beginning. More focus is on fuel. So again, there's a bit of a challenge there. For an API industry, you need massive economies of scale. I will give an example of phenol, which is the starting material that we look at for paracetamol. Every year, about 7 billion kilograms of phenol is produced. And that's because it's a precursor for so many other things. It's a starting material for so many other things, for plastics, for fertilizer, for chemicals, for insecticide. So for you to be competitive, you need to have massive scale. But for you to have massive scale, you need a good market. And we've seen that Nigeria's market is quite small. So there's a bit of a challenge there. And of course, the infrastructure for that, in terms of waste management, in terms of purification, probably does not exist as it should. And of financial capacity, human capacity, we've seen that I don't know how many of us were actually taught how to make APIs in pharmacy school. If I was taught, I confess, I don't remember. So that's some of the things that we need to be looking at. But again, it's not all doom and gloom. There's a simple roadmap, which I probably will just share briefly, of how to make Nigeria to be producing API in the shortest possible time. For example, again, let's start from the previous slide where we look at the economies of scale. The country and no country will be able to make every API. You need to actually prioritize and determine what is important to you. For example, it may be that we'll make a choice of we want to make 2 or 3 or 4 APIs in, say, anti-malarials, where we have some economies of scale because we are the largest black nation. Malaria is a problem in the tropics, essentially. We are not going to be competitive in making APIs for paracetamol. China has a stranglehold on that market and it will continue for some time. But we can be competitive and we can be viable if you look at anti-malarials, for instance, because we can have economies of scale relative to every other market. That's one of the things that we should look at. Maybe we should start, for example, from pooled procurement. Again, I'm sharing strategy that has worked elsewhere, where, for instance, maybe government or the central bank or any agency of government does what they call pooled procurement. They get the requirement for all the manufacturers for, say, one particular product, one particular API, They pool the resources, and for a start, they import it for them. So they save them the stress of all the clearing charges, a lot of charges, and they start a process of backward integration for that particular API. That, of course, will require collaboration and partnerships, because there are people that already do these things who can get a lot of help for them. Just as we are collaborating with a local manufacturer or making medicines that will be exportable from Nigeria, we know that one of the lessons that COVID taught us is that no company really can do anything alone if you want to achieve it quickly. There are many companies that are willing to partner with companies in Nigeria as long as the right contracts are in place and the right environment is in place. So that's probably will be a second step or a third step to look at collaborations and partnerships. Government incentives for API, because it is capital intensive, are mandatory. Tax incentives, guaranteed markets, a lot of incentives that we can talk about, but in interest of time, I probably won't go into too many of them. Then we can also look at, do we want to start from phenol or want to start from an intermediate, para-aminophenol, for instance, and again, backward integrate? Remember that we know where we're going, but it takes some steps to get there. And this journey, it's not going to be a journey of 1 year or 2 years. I know that Emzo announced that this manufacturing sometime last year, but I'm not sure they've started because, again, there are things that need to be in place. And I'm just sharing this as some of the tips. Probably one of the very critical things to look at is what technology are you going to employ for the API industry in Nigeria? There are many, basically from your crude oil, most of the materials you do chemical synthesis, or you could do some biological catalyzation. But one of the things that we need to note is that we cannot compete with the established manufacturers using the same technology or the same platform that they're already using. So how do we disrupt? How do we innovate? How do we do like what the fintechs have done to the banks? How do we employ a leapfrog technology so that what China has been doing for the last 20 years, we don't compete with them on that level, but we go a different route? One of the things that's happening in the world right now is that depending on the molecule, people are gradually moving away from chemical synthesis because it's extremely capital intensive. It generates a lot of waste. And people are looking at how can we do some biological synthesis? Is it right for us to begin to explore that? I'll give a good example with the COVID vaccines. COVID vaccines normally will take about 10 years to produce a vaccine. I spent about 5-6 years of my career working in vaccines. But COVID vaccines was produced in 1 year. And many of these elements that are being shared here are what enabled COVID vaccine to be possible in less than a year. For example, the government incentives. The government of the US then put down billions to incentivize. They gave them guaranteed markets that just produce this vaccine, we'll buy. There was no company that worked alone. Even though they were on one side competitors, but when it came to tackling that issue, they began to collaborate. Again, people that won the race for COVID vaccine did not use established technologies. mRNA, which most of them use, were used for the first time for COVID vaccines. You're not going to compete with established vaccine manufacturers on wholesale vaccines or an adjuvant and win. Just like if we want to start an API industry in Nigeria, we should not seek, it would be dangerous to seek to compete with China on technology that they honed over the last decades. So we should think, how do we innovate? How do we disrupt? How do we have a paradigm shift? How do we change the game? And if we do all that, an API journey can be done very, very, very shortly. But importantly, where we're going, we're not doing API for the sake of API. My time is it's almost up. We're not doing API for the sake of API. Remember where we really are going. And where we're going is medicine security. Medicine security. I want us to just go back there again. But we've seen that the role of API production is critical. Because you cannot really say you have security if for every single ingredient you are using, you are dependent somewhere else. But at the same time, you're not going to start doing everything by yourself in one day. That is why the drug policy in Nigeria says 70-30. It didn't say 100-0, because 100-0 is not possible. So again, for what would it take for API production? Prioritization. What molecules are you going to make? I would recommend, for instance, that in Nigeria, there's really no point going beyond, at the start, maybe 6-7 molecules, 6 actives. We cannot make everything. We must collaborate. We must partner. Local and global, multinationals and local. Then we must have what we call patient capital. Because the returns on API is not something that you're going to get in 2 or 3 years. It takes time. And that patient capital, very patient capital that will not risk-tolerant capital, it needs to come with government incentives. I know the CBN has done quite a bit of intervention, but it probably not as, for a number of reasons that we can't begin to discuss here, probably not achieved what it ought to have achieved. But we still need to have some level of incentives for people that do go into it. Then for anyone that's going to it, please make sure that your technology is state of the art. Don't use technology of 10 years ago to start API today. You're not going to be competitive. It is not going to be sustainable. And probably most importantly, let's focus on the demand side. How do we grow the industry? I'm pleased, for instance, with the National Health Insurance Act that's been signed, because if it's implemented the way it should be, it begins to grow in the industry. So that what everyone present here, what every pharmacist here will benefit, the pie grows larger. It seeks to bake a much bigger cake. I'm going to probably just end with sharing this slide, which I will say is a beginning of a roadmap. Drug security in Nigeria can be achieved in the next 5 to 7 years. It's possible to achieve that in the next 5 to 7 years. You will see a lot of Greek on that slide. You will see a lot of Greek in that slide I can't read. And why is it there? I just want to illustrate the fact that drug security, the journey into that drug security, it needs to be very intentional. It's not going to happen by accident. And is that lack of intentionality, having clearly defined goals, having clear strategic objectives, having action plans that is reviewed and measured every 6 months, every 12 months, every 18 months, that piece is still missing. That is why all that is in Greek. And I can tell you that it's not going to happen by itself. If you remember the second law of thermodynamics, nature, it tends to entropy. Everything tends to disorder unless it's put in order. So my charge to PSN, national, which I'm sure probably PSN Lagos can take a lead in, is to begin to advocate, mobilize for having that intentionality of that strategic action plan for drug security in Nigeria, which we can achieve in the next 5 to 7 years. And if we are able to achieve that, what we'll have done is that we'll have baked a much bigger cake and not struggling over the current small cake that everyone has. And everyone benefits. The community pharmacist can probably be selling 10 times more than he or she is selling now. The industry can be selling maybe 5 times more. Same in the hospital. The academia can have much more students, which they are sure that when they train them, there's somewhere for them to go to. This is possible. And I'm sure together, all of us can make this happen. Thank you very much.
We can do more. We can do more. Thank you, sir. Thank you, sir. This is beyond keynote address. It is keys note address. We have so many keys there. Is that not so? We have so many keys inside what he said. Honestly speaking, when I saw the theme for the year and I saw the police, I said, thank God, police has come to secure our medicines. I didn't know that it's another. You see the reason why you must attend conferences and seminars? Because you will just sit down at home and you will think you see the topic. You will say you know the topic. And when you come, they give you an exam. You'll be looking for crystal stones. Okay, thank you very much. That was a wonderful one. Wonderful one. We are impressed. You can't go to Ife and come back and be talking something else. See, this thing no be about belle matter. It's a matter of standard there. Yeah, the standard is there. Thank you very much. All schools of pharmacy are doing very well. And I believe the deans that are here can innovate. The next 2 years of, when we have the next pharmacy week in 2024, please, we want to hear good news. And I'm saying this with every sense of respect and authority. My first son is studying pharmacy in Ife. And he's bringing the same notes I left there. I told him, I said, I was looking for my friend. I gave my notes when I was graduating. I said, you should go and collect the notes and be reading it ahead of time. So please, we need to innovate and innovate very well. So let me ask my apps. You can see that my left hand is very loaded. You can't shake me here. So let me ask her to talk to us a little bit.
All right, a round of applause for ourselves. I believe we've been having a wonderful time. We'll be going to the presentation of awards now. And I'll be inviting our own chairman, pharmacist Iola Bolagade, to preside over that session. A round of applause for him as he comes forward.
Distinguished colleagues, our chairman of the occasion, I want to appreciate you so much for your patience and the rapt attention that you have granted to us today. Where we have class of awards, but first of all, we need to appreciate the dignitaries that are here today, because you need to know the trepidation I had in the morning as at 9:30, 10 o'clock, when I have not been able to see any of them until when Mr. Registrar majestically walked in, and followed by our keynote address speaker, because they are the ones that have made this day very wonderful. So we are going to start with the appreciation award for our dignitaries. And I think it's better we start with our speaker for yesterday. Yesterday we had master classes, and there was a motivation lecture. The lead speaker there was our colleague, pharmacist Mrs. Temidai Adetola. I would like her to step forward to receive this appreciation award for the erudite delivery we had yesterday. For those of us that joined us online and those that were physically present, you will all agree with me that the lecture of yesterday was masterfully delivered. So let's give her a round of applause. And the other master classes were delivered by our colleagues from the industry. So we couldn't make any arrangement for them because we did not even know who is coming to present. But I think we'll take a cue from this and ensure that we are doing the right thing next time. So to present the award, I would like to call on our father, pharmacist Olaide Oshundeko, to step forward and present this appreciation award on behalf of Lagos State PSN. Thank you so much, sir.
On behalf of Lagos State Branch of Pharmaceutical Society of Nigeria, I present you this award. We thank you for the job well done, and we pray that God will continue to strengthen you, give you wisdom and knowledge to continue to deliver more of it. Thank you very much.
I'd like to invite the representative of the Commissioner of Police, to come and receive this appreciation award on behalf of CP Abiodun Alabi. I think our director of ceremony was actually correct because police in Lagos Command have been very cooperative with us for PIC operations. And anytime we need security cover, they are always available for us. And the new CP resumed early this year. And we were well received when we visited him. And since then, we've been making overtures to him. He has been responding very professionally. So it's my honor and pleasure to ask, where's my immediate past chairman? Because in our approach, it's like police too. Okay. Okay, if she's not there, let me call on. I would like to call on pharmacist because I can't. Okay, yes, you are here. DPS ma. You know, follow us, go see police. So come and shake the hand of police now. Come and help us present this award. A round of applause for Mrs. Oyebisi Olmalambe, the DPS Minister of Health, Lagos State.
On behalf of the Lagos State PSN, we present this to the CPC, am I right? CP. Okay, we present this to the CP, Commissioner of Police. We appreciate his good work and we appreciate his cooperation.
Yes, I think I would like to call on a member of the Governing Council, a PSN representative, to present this award to our brand new registrar because they are the one that got the registrar for us. I'd like to call on Anthony Bola Oyawole, fellow of the society, to step forward as the registrar. Pharmacist Ahmed Babashew, fellow of the society, step forward to receive this appreciation award. A round of applause for our registrar, brand new registrar of Brown New Council.
Mr. Registrar, our own dear Babashew, on behalf of the Pharmaceutical Society of Nigeria, Lagos State, I present this appreciation award to you for gracing this year 2020 Scientific Week. We love you, and we love Mama Shehu also. So say us well to Mama Shehu when you get back home. Thank you.
Okay, let me call on Chief Yetunde Morondia to step forward. No, sit down. I want it to be halves to halves. Let me call on, do we have Dr. Solomon Agbabua here? Yes. A round of applause for him because he's our chief mentor to the young pharmacists. I want you to step forward to present this award on behalf of PSN Lagos State to the special guest of honor for today, pharmacist Patrick Aja, the managing director of May and Baker Nigeria PLC.
Thank you so much, Pat, on behalf of PSN Lagos. Be quite supportive and coming to grace the occasion this year against another plus in your services to PSN. Thank you very much. Thank you. Well done.
I want to call on Professor Aderonke Adipojubelo to step forward to present this award of honor to our keynote speaker of today. The reason is it's not far-fetched because you are a professor of pharmaceutical chemistry, and I think we were taught a bit of chemistry. We were reminded of the synthesis of paracetamol today. So I think it's better you'll be in best position to, because there is need for us to connect the TAN and GAN together. I know we still need to work together, the researchers and the industrialists. So can you please help us, sir? Fellow of the Society, Kunle Oyelana, for a job well done, sir.
On behalf of the Lagos State PSN, I present this award to you for the job well done. We all enjoyed the presentation. Thank you.
Thank you so much, ma. Let me call on past chairman of Association of Ladies Pharmacists and current vice chairman of Board of Fellows of PSN, my own auntie, Chief Yetunde Morondia, to step forward and present this award on behalf of PSN Lagos State Branch to the chairman of the occasion, Dr. Mrs. Stella Okoli, ably represented by pharmacist Mrs. Uzoma Ezeoke. A round of applause for her.
Up-ups. Excellence and service. So, I don't even know what to say. Your mom is so dear to Alps. She's so dear to pharmacy. Presenting this award is just a tip of the iceberg of what we feel for her. She's a wonderful woman. Just last week, somebody from a church said, I saw one of your colleagues in my church. She's such a giver. And I said, who is that? She said, Emzo. Oh, I felt so elated. So she's always a cause for celebration. Extend our warmest regards to her. On behalf of PSN Lagos State, we make this presentation in appreciation of today and all she does all the time. Thank you very much.
She will hear. Thank you. Can I say anything? No, all I have to say is she will hear, and thank you for the love. Thank you.
This year we recognize two of our elegant stallions. And because it is their turn to be recognized as pillar of pharmacy in Lagos State, and I'm sure beyond Nigeria and West Africa. And when we consulted the Oracle? The Oracle has chosen two very distinguished colleagues, Dr. Stella Okoli, number one, and number two, Professor Cecilia Iguilo. She's unavoidably absent, but I think I prefer that the representative step forward. The Secretary of APS is taking the award on our behalf. Please, can you please step forward? That is the APS style. So, I will like, before we read a brief site, let me hand over to the...
This is an abridged citation of an already abridged citation. Dr. Stella Okoli, she is the chairman, MD, CEO of Emzor Group of Companies that also houses Emzor Hair School. She graduated from the School of Pharmacy in 1969, University of Bradford, and also got her MSc in biopharmaceuticals from the University of London, Chelsea College in 1971. She has attended several management trainings, including executive management programs of the Harvard Business School, Boston, US, and several others. She started a pharma career in the UK as a clinical pharmacist at Middlesex Hospital, London, worked at Boots. No wonder she came home to reboot the system. She started Emzor Chemists Limited in January 1977. And as at this moment, from what we saw when they presented to us, she has more than 4 different, is it 4 or 5? 4. Maybe I'm prophesying. 4 manufacturing outfits in Nigeria and still counting. She has over 140 different products, ranging from anti-malaria. Thank you. Please, she deserves more. Anti-malaria to vitamins, hematinics, cardioprotective drugs, and antibiotics. Emzor currently has heavy presence in West Africa, with offices in Liberia, Sierra Leone, Ghana, Mali, and in Asia, India. Pharmacist Dr. Stella Okoli, FPSN OON, continues to be a model, pacesetter, and a light bearer to the glory of God. I present to us the Pillar of Pharmacy Award 2022 recipient, Dr. Stella Okoli.
There's no other person I will call than our very dear own Baba Adeleke to step forward. Please, I want somebody to assist him to step forward because we've felt the presence of Dr. Mrs. Stella Okoli during his birthday on Saturday.
Well, I don't really know where to start. You see, we admire people for various reasons. And briefly, I said on that day, we have action and reactions. I knew Stella, when we were moving around, those early days, dictating drugs. And you see what has happened, like a mustard seed that become gigantic. But something happened some years back. A prominent son, lawyer, Chike Okoli, in the gym, just collapsed and died. I was told that he was saying that, my mother, when did you become a millionaire? I will be a millionaire before you. But what happened? And I was saying reactions. Some people will say, go and commit suicide. Some people will blame God. I had a student at Ife at that time, the time of his entry into the university. His father died. He was a Christian and said, God, you did this to me, just entering the university. They want to train me. He killed, and you are. He said, I have nothing to do with you, God. He would just go to the dining hall and we'll go to the hostel. But people, children of God, rallied around and restored him. Later on, he became Archbishop of an Anglican communion. I would not like to mention his name. So this woman, instead of going to detect serious problem, melancholy, he set up a business entrepreneurial system in memory of this young man who never even got married. And thousands of people are benefiting. I just see her, I admire her. I see some people like that, but she's among the outstanding one. So it's a lesson for us. The downfall of a man is not the end of it. You can see what he said, you are just starting. I'm not surprised. Thank you. This appreciation award, you have been appreciated in all areas of endeavor. Continue. What you are doing for Chike, we outlive all of you. And many people will continue to benefit. It's a lesson. On behalf of the Pharmaceutical Society of Nigeria, Lagos State Branch, we are saying thank you. It's just a token of the appreciation. Thank you, my colleagues. This state branch is lucky. You have leaders that are doing well. We started humbly, and things are improving. Oh, you make me happy. Thank you. God bless you.
Yes, it's the turn of Professor Cecilia Iguilo. I call the APS Lagos State Secretary to step forward. And I think for our ladies, we need to give them this honor. I want to call on Dr. Afusat Additional, the chairman of APS, to step forward to present the award to an Appian of distinction. And I will hand over the mic to the director of programs to read their bridge CV.
Thank you, Chairman. Before I do that, I want to recognize the presence of the chairman of PSN Ogun State, with the vice chairman. They spent just 8 hours in traffic. Pharmacist Adewale Adenugba, FPSN chairman, Ogun State PSN. You're welcome, sir. And Pharmacist Olumide Ubube, MAW, Vice Chairman, PSN Ogun State. You're welcome. You will share the grace. This is Lagos. This is Lagos. Distinguished Professor Mrs. Cecilia I. Iguilo is an accomplished pharmacist, academic researcher, educator, and administrator par excellence. To the glory of God, her contributions to national development has won her recognition by the federal government of Nigeria, leading to the award of the Officer of the Order of Niger ON. Her remarkable contributions to the University of Lagos and its students have seen her recognized as a distinguished professor. In pharmacy, she has contributed widely to the development of postgraduate education, undergraduate education, and provided mentorship for many pharmacists. She has been recognized and decorated with many prestigious fellowships, including Fellow of the Pharmaceutical Society of Nigeria, Fellow of the Nigerian Academy of Pharmacy, and Fellow of the Postgraduate College of Pharmacists. I thought you were going to clap. Professor Iguilo is the president of the West African College of Postgraduate College of Pharmacy and continues to serve in various capacities nationally and internationally. She has more than 60 research publications, including participating in developing formulations and active pharmaceutical ingredients in clinical use. Thank you. Professor Iguilo obtained her first school living certificate with distinction in 1964. Somebody say, wow. And her West African school certificate in 1971, making grade 1 with distinction. She proceeded to University of Ife, now Obafemi Awolowo University, OAU. Graduating, yes, you can do that. Graduating with a Bachelor of Pharmacy Honors in 1977. She completed a master's degree in pharmaceutics in OAU in 1979 and completed her doctoral studies in Chelsea College. I saw Chelsea somewhere at that time. University of London in 1983. She became a professor on October 1st, 1994. So she's celebrating on Saturday, making her the first female professor of pharmacy in Nigeria and the entire West African region. Yeah, she was Dean School of Pharmacy, University of Lagos, 2001 to 2003. Professor Iguilo has won several national and state awards, including Federal Republic of Nigeria Scholarship for Postgraduate Studies in Chelsea College, University of London in 1980. She has also been recognized for her distinctive service as Merit Awardee of PSN Lagos Chapter, Association of Lagos Lady Pharmacists of Nigeria, APS, and the Nigerian Association of Pharmacists in Academia. Professor Iguilo was born on January 23rd, 1953, married to a petroleum engineer. So they can connect it to now, we can get our APIs. Named OC, and they are blessed with 4 children, including me. Thank you.
And me too. Thank you very much. It's a privilege and honor to present this award. You will agree with me that she's indeed a pillar of pharmacy. So, and I'm happy to present this award to her. I'm so excited. So, presenting this award on behalf of PSN Lagos State to Dr. Dorcas Omera, receiving it. I'm sure she's very happy. Thank you very much.
Thank you. Okay, thank you. Please permit me. She asked me to say something on her behalf. But before I go on, I want to confess that actually my head is too small to wear her cap. I had to put this turban so that to make my head bigger. Then, for those who know me, I don't wear turban. Then, my shoes are too small. So I'm begging all the lady pharmacists in this hall to join me to wear this her cap and to wear her shoe so that I can be able to say what she asked me to say. Thank you. Yeah, so the first thing she said, she would have knelt down to give all glory to God. So all glory to the Almighty Father. Yes. I'm actually her first daughter. Others are after me. So, yes. So secondly, she is sorry. She apologizes for being unavoidably absent, that she would have loved to be in this gathering. She's away anyway on a happy note to do Omugo. Yeah, so yeah, she's attending to her second grandchild, and she and her babe are over there. When I say her babe, that's her husband. Wow. Yes, they still call each other babe till today. So finally, she's very appreciative, and she prays that that PSN Lagos, PSN Nigeria, Pharmacy Worldwide will keep moving in the special grace of God. Thank you very much. Ups. Excellence and service.
Well, the next category award is about excellence. You know, we are in a state that is dubbed Center of Excellence. This year, we have Excellence Practice Award in all the 4 categories of our practice. And we are starting with community practice. So I would like the national chairman of ACPN to step forward to present to two of the awardees. And then I call on Larry Familusi, Fellow of the Society, to step forward to present to the other 2. And the first person that will step forward is Pharmacist Omobolanle Adekunle. A round of applause for her.
Thank you so much. Ladies and gentlemen, behold from Mrs. Omobalanle receiving the very prestigious service award from the Pharmaceutical Society of Nigeria, Lagos State. Congratulations.
I'd like to call on pharmacist Mrs. Ayodele Ogunlade, Merit Award winner, to step forward.
Pharmacist Mrs. Ayodele Ogunlade, here is a recognition award and service award for your immense contribution to community pharmacy development in Nigeria and to the service of the Pharmaceutical Society of Nigeria, Lagos State Chapter. Congratulations, ma. We have heard that we need to grow the pie, and here is somebody who is already growing the pie for pharmacists in Nigeria. Thank you so much for all you do as a community pharmacist and for the Pharmaceutical Society of Nigeria in Lagos State. Congratulations, ma.
I want to call on pharmacist Isaac Olufuminiyi to step forward to receive his Practice Excellence Award. By the way, he's the chairman of the Idea Zone, a zone in Lagos, a zone of ACPN that is bigger than many state branches in Nigeria.
Well, even though the chairman punished me waiting before this time, but I'm doing it to a man that we belongs to the same area. Pharmacist Isaac Oluwafuminiyi, Merit Award winner in recognition of your distinguished service to the profession of community pharmacy practice. During the opening ceremony of the 2022 Scientific Week of the Pharmaceutical Society of Nigeria, Lagos State Branch, held today at Sheraton Hotel. Congratulations.
I want to call on pharmacist Mrs. Mojisola Aladesanmi, Merit Award winner, to step forward.
Well, I think this is an arrangement by the chairman. I don't know why. I do it for the Society for Pharmacy. This is a practice award of Practice Excellence Award presented to pharmacist Mrs. Mojisola Aladesanmi, Merit Award winner, in recognition of your distinguished service to the profession of community pharmacy practice. During this opening ceremony of the 2022 Scientific Week of the Pharmaceutical Society of Nigeria, Lagos State Branch, held today. Congratulations.
Let me call on the immediate past chairman of PSN Lagos State, pharmacist Mrs. Bolanle Adeniran, to step forward. You are the one that will present these 3 awardees in the hospital and administrative category because you are involved. So I call on pharmacist Olusegun Anakoya, the DPS Health Service Commission, to step forward for this award.
Well, our local. It's a great delight and joy to present this Practice Excellence Award to one of my own, Shegun Onokoya. We were together at the Health Service Commission, and I'm glad you are still doing the profession proud. God bless you. In recognition of your distinguished service to the profession in hospital and administrative pharmacy practice, during the opening ceremony of the 2022 Scientific Week of the Pharmaceutical Society of Nigeria, Lagos State Branch, we present this award to you. Congratulations, and more of it to come.
It's your turn, ma, our DPS. Pharmacist Mrs. Oyenike Omolambe, Merit Award winner of this state branch. Oyebisi.
Congratulations, my dear sister. Thank you. And I am glad that this award is being presented to you. In a short time that you have been the DPS, you have really shown us that you are somebody to reckon with. You have moved, especially the PIC, to another level. And I'm very, very proud of you. Thank you for doing us proud. God bless you.
The next awardee is the Zonal Director of PCN in Lagos. I call on the representative of pharmacist, Dr. Ukamaka Okafo, who is unavoidably absent today. Pharmacist Samuel Onoja is supposed to represent her. Please step forward. You are Ukamaka Okafo today now. I don't need to call your name. A round of applause for our Zonal Director. We have been working together.
It's also my pleasure to give this Practice Excellence Award to Amaka. Tell her that we are very proud of her. She receives a lot of bashing from us because we are together. We want to move the profession forward, and she is always ready to do whatever it takes to ensure that the practice is what it's supposed to be. Thank you very much. Give our regards to her.
Thank you so much. Yes, Mr. Registrar, you still have some assignment for us to do here, because from next year, we'll be seeing your signature on our licenses. And I think it will be so apt for you to be the one presenting to our colleagues in the industry. We have a crop of about 6 of them that we are giving award of excellence to in industry category. And they have the honor and privilege of calling on pharmacist Olakunle Ogunlowo of Pfizer to please step forward. A round of applause for him. Are we hungry? Don't worry, we are almost done. Okay, we are fasting. Yes. We are breaking 7 p.m.
On behalf of PSN Lagos State, I have the privilege to present to you this award of recognition for your distinguished service to the profession in the industrial pharmacy practice. Congratulations.
I want to call on pharmacist Mrs. Ijeoma Erukalu of GSK to please step forward for your Practice Excellence Award. A round of applause for her.
On behalf of the PSN Lagos State, I have the honor to present to you this award in recognition of your distinguished service to the profession in the industrial pharmacy sector. Okay. Congratulations. Thank you.
Pharmacist Abbas Sonny of GSK, please step forward. A round of applause for Pharmacist Abbas Sonny.
Pharmacist Abbas Sonny, it is my pleasure on behalf of Lagos State PSN to give you this award in recognition of your distinguished service to the pharmacy profession in industrial pharmacy practice. Congratulations.
Thank you so much.
I want to call on pharmacist Obinna Emeribe. Pharmacist Obinna Emeribe of May and Baker PLC. Yeah, step out. Okay. Yes, let's. Do we have pharmacist Friday George here? Friday George, the marketing director of Pharmates. A round of applause for him as he's stepping forward. Friday George.
Pharmacist Friday George. It is my pleasure on behalf of Lagos State PSN to present this award to you in recognition of your distinguished service to the pharmacy profession in industrial pharmacy practice. Congratulations.
Thank you. It's my pleasure and honor to invite pharmacist Mrs. Uzoma Ezeoke to please step forward. You have been recognized for excellence in Lagos.
This is a true confirmation that our chairman of the day is a chairman that is worth to be chairman. Congratulations. This time around, not in a representative capacity, in your own capacity, for who you are and for what you are doing to the pharmacy profession. Thank you very much and congratulations. Thank you.
Please, we're all in this together. So this is for all of us. Thank you.
Then I want to call on pharmacist Obinna Emeribe once more. He's no longer around. You can come and take on his behalf. Maybe he has gone to collect a check because the marketing manager of May and Baker.
Wow. On behalf of PSN Lagos State, I present this to pharmacist Obinna Emeribe in recognition of his distinguished service to the pharmacy profession in the industrial pharmacy practice. Thank you.
Yes, it's our turn. We members of NAPA. Yes. I want to call on our immediate past Dean. Oh, no, not immediate. I think former Dean, Professor Bolaji Kwaina, to step forward. You help us in presenting this award because I want it to be Dean to Dean. Then I would like to call on, I want to hear the voice of our MD, May and Baker again. You present for the last two because we want the industry to connect with the academia. I call on our present Dean, current Dean, Professor Aderonke Adepoju-Bello, to step forward to receive this award of excellence.
My dear ma, on behalf of PSN Lagos State, you have been presented this in recognition of your distinguished service to pharmacy profession in academia. Congratulations, ma.
Dean, please come back, ma. Come back, ma. Yes, we had a very scintillating lecture at the Napa Day on the theme of the week. And for your information, I told the Napa member that Dr. Chukwemeka Azubuike is my twin brother. You see, he's shorter because I press him down very well in the womb. So he did a marvelous job as well, just like he gave us the academic perspective as much as we had the real reality from the industry today. So it's a pleasure and honor to invite you to come and receive this award of excellence in academia.
He was my sub-dean when I was dean. So on behalf of Lagos State PSN, Dr. Chukwemeka Azubike, in recognition of your distinguished service to pharmacy and professional academia, you have been presented this.
So I call on Pharmacist Patrick Ikeja to please step forward. We still have two more, so there must be connection. Yes, and me and Baker has taken a lead in collaboration. I want to call on Dr. Margaret Ilumaya, our current editor-in-chief of Pharmaceutical Society of Nigeria, not Lagos State, or national, worldwide.
Great. Dr. Margaret, on behalf of PSN Lagos, this is an award in recognition of your practice excellence. And like you said, I'm glad that the industry is connecting with the academia, and we wish that you do a whole lot more. I'm also using this opportunity to inform our colleges of pharmacy. We have a partnership with NIPRIT. Other research institutes, May and Baker is glad to partner with you to launch more products. A professor in Uniben we're partnering now. So please do more. Congratulations. Congratulations.
The last but not the least, our current chairman of NAPA in Lagos, former editor-in-chief of PSN, and former assistant national secretary of PSN. A round of applause for our chairman of NAPA in Lagos, Dr. Arinola Joda.
Okay, congratulations, Dr. Joda. This is a recognition of your practice of excellence, both to Lagos State and to the national body. And like he said, we are glad to collaborate in whichever way. May and Baker is prepared. Congratulations.
Yes, I think I will be an ingrate, and all of us will be an ingrate if we don't recognize the chairman of the planning committee, and by extension, the committee members for putting this together. I think we have really witnessed a very beautiful occasion here today. And for that, I think we need to appreciate the chairman of the planning committee, Dr. Titilayo Onedo, fellow of the Pharmaceutical Society of Nigeria. And because we are so secure here today, and we are talking about medicine security, so no other person will do the presentation of the award than the ACP representing the Commissioner of Police. You can see that we have brought you in. We don't want you to embarrass our community pharmacists, though, because yes, we agreed. We agreed, ma. Please.
Because police is your friend, I am presenting this to Pharmacy Dr. Titilayo Onedo. I wish you all the best, ma. And God will continue to uplift the AC, PC, PSN, Lagos State chapter. All the best. Thank you.
Congratulations to all the awardees, and congratulations to PSN Lagos State. Please, can we give the chairman a round of applause? Chairman, you came with nothing and you are going with nothing. Announcement. Time to eat. Please, I want to implore us, and I pray that what happened in 1942 will not happen here today. I was called to come and anchor an event in Luxembourg in USA. And the lesson I learned from that day, I will never forget. I finished the program only for me to get to the buffet. They said it's finished. And from that day, I've always requested I should be the first person to be served. So today will not be an exception. I'm close to the high table. Please, let's follow the directive. Those on the high table will go first. And the table that houses, is it the table that houses or the table that sits, or the chairs that sit the past chairman, or that started the past chairman, will be next. And of course, to table 2, where I'm seeing my old friend whose cap is looking like that of Afeni Ferry. Pharmacist Niyi, how are you, sir? God bless you. Announcement. PMG Man cordially invites all pharmacists to the 6th Nigeria Pharma Manufacturers Expo, taking place on the 18th and 19th October 2022 at the Heaven. When I thought it was Heaven. At the Heaven, Oba Akinjobi Street, Ikeja, GRA. Announcer, Secretary, PMG Man. Please, let's try and be there. Please don't get up from your table until you are asked to do so. You should remember that the registrar is here, and your license can be withdrawn or withheld if you do not meet pharmaceutical standard while you are being served. Thank you for the light music.
The Pharmaceutical Society of Nigeria, PSN, Lagos State Branch, presents grand opening ceremony of the annual Pharmacy and Scientific Week 2022. Theme: Innovative Approach Towards Ensuring Medicine Security. The place of local production of active pharmaceutical ingredients in Nigeria. Under the distinguished chairmanship of pharmacist Mrs. Stella Okoli, FPSN, OOM, the Managing Director and Chief Executive Officer, Emzor Group of Industries. Special guest of honor, pharmacist Patrick Aja, MD and CEO, May & Baker PLC. Guest of honor, pharmacist Ahmed Babashehu, Registrar Pharmacist Council of Nigeria. Keynote address, pharmacist Kunle Oyelano, MD and CEO, GlaxoSmithKline Pharmaceuticals Limited. Guest of honor, pharmacist Professor Cyril Usifo, President, Pharmaceutical Society of Nigeria. Chief host, pharmacist Iyola Bolagadi, Chairman, PSN Lagos State Branch. Date, Thursday, 29th September 2022. Venue, Sheraton Hotel, Ikeja, Lagos. Time is 10 a.m. prompt. Red carpet starts by 9 a.m. This hybrid event will be streamed live on PharmaStream TV, YouTube, Facebook, and Zoom platforms. Subscribe today for instant notifications when event goes live. Announcer, Pharmacist Dr. Titilayo Unedo, Chairman, Scientific Week Planning Committee.